Good morning, everyone. I apologize that we're being a little delayed. We've had technical difficulties this morning, which, from what I understand, probably aren't as bad as what happened with Zoom the other day when the whole thing crashed. But we're having some challenges, so we're going to get started here in just a minute. I'm pulling up my screen now, and what I would like for you to do is to let me know both if you can hear me and if you can see me. If you can use the chat box, and then let me know whether we have audio and video. Yes, can see and hear, audio and video, good. Thank you. I'm thankful to know that we're now getting off on the right foot. So Lisa Bennett Perry will join us shortly. Darren Paskey and I are here this morning in order to get you started. We are going to do training on supervisor responsibilities, principles of IPS, and some just general information for agencies that are participating in the SUD supported employment grant. So with that, Darren, can you also see the screen? I'm going to turn it over to you to get started.
Yes, Don, I can see the screen. Can you hear me?
Yeah, I can. Good deal. So, all right. And Darren, tell me how far I need to advance in order to get to the slide that you need to start with.
Oh, I don't know what number. I think there was like 5 or 6. Oh, there we go. Back to the blue dots.
That one? There we are. And once again, I'm going to apologize to everybody that we're kind of fumbling a little bit, because we're fumbling a little bit. Things have gone south this morning. So, Darren, you're on.
Okay, do I have access to do the slide advance?
You do not. Go ahead and start, and I'll advance them for you.
Okay. Good morning, everybody. Thank you for joining us today. My specialization is going to be talking about the principles of IPS. A large part of IPS is a standard of quality. And our philosophy here at the Healthcare Authority is to focus on building a collaborative learning community of IPS supportive employment providers. So all you attendees today are part of our larger group of people supporting our mission to do that. And what I'm going to talk about today is these 8 principles that provides a standard of quality and a base to grow the program. Next slide, Dawn. Is it able to advance? There we go. Oops. There we go. Thank you. Employment is a lot about recovery and empowerment and honoring people's choices. Historically, many supportive employment programs have had components where they talk about people being ready, people being compliant with their medication, individuals being compliant by making so many appointments before they can be referred to an employment specialist or an employment program. There might also be some sections where there's some prescriptive treatment or concrete groups or process that people need to complete before they're able to move into a competitive employment focus. IPS is very dynamic in terms of they want to honor the individual, which I think is a great basis to focus on recovery, because we're focusing on people's choice, that the individual knows when they're ready to make a change in their life. the individual is ready to start the employment process, we need to honor that choice and look at supports that we can provide around them. Career profiles really focus on strength-based service, and this is very focused on building a relationship with the individual to help them start their journey. An important part of IPS, it's an evidence-based program. There's been 28 separate sites where this has been evaluated, where the evidence supports if you implement the Fidelity Scale, people will become employed. Historically, supportive employment programs may have been from 15 to 25%. Currently, for 2019, (2001, 2002), when the Dartmouth started implementing this model. A large focus of the Fidelity process is promoting competitive work. Programs in the past had stepping stones where maybe there was mandatory volunteer work, maybe assessments in the community, maybe working for an in-house process for free. So we really want to change the focus and focus on competitive employment. And I think it brings our focus together, because as you and I are currently engaged in the process, we all have competitive jobs. I remember when I came out of, even before I was in high school, I was working. So part of my family dynamic was really focused on going to work. And I think many people across the spectrum in our society really focus on competitive employment as being an active member of society, and IPS really aligns with those goals and those missions. There are some specific things we do look at in the principles of IPS, and something that we look at when people just start to come in an agency is the agency including questions about employment. And it's not just if they are interested, yes or no, but are they currently looking for work? Do they see themselves working in the next 3 months, 6 months, those type of time frames, so that initial conversation can start at intake and flow through the agency. Also, we want to see that there's fluid dynamic questions about employment in treatment plans, in assessments. IPS has a great career profile on their library section on their website, and it's a very thorough assessment that talks about goals and jobs and employment history and military history. So it really encompasses a great assessment feature of people getting ready to return to work. Next slide. This is just some additional things that we look for as IPS reviewers and adherence to Fidelity, that we also want to see that there's a culture change throughout the organization. And some of the ways this is done is through display of brochures. Maybe there's some bulletin boards, maybe there's some IPS posters, maybe there's additional things that really focus on employment and independence in the community. And we want to see this start in common areas where there's staff, where there's program participants, where there's clinicians, so everybody gets the same message across the agency. Next is the real focus that people who are participants in the program have an opportunity to share their stories. This might be through yearly or events every 6 months. We had one agency that pre-COVID did a picnic once a year that brought people across the agency together to honor those people who are going to work. We have another agency that we've worked with where they put out a monthly newsletter that kind of gives updates about the employment staff and changes in the program and success stories. Those are very robust things that we like to see, because we can really see the culture change within the organizations that's really focusing on the transition into competitive employment of participants. The other important feature that we look for in IPS reviews is that agencies and programs are actually measuring employment outcomes, and that this measurement happens within the program, but the program manager and the program supervisor is actually taking it to other levels of the organization to share. So this is a really important metric as we are in a very outcome-orientated funding process in many aspects. Evidence-based programs with very solid outcomes is a great way to market the program and really demonstrate the changes we are making in people's lives. Next slide, Don. A very important part of the employment services program is integration. And this is definitely one of the challenges where the employment specialists, the employment specialist supervisors, the program managers, they're all champions of change. And it really takes a lot of work for these individuals to network within the organization to move the culture into the IPS model where competitive employment is the focus. And an instrumental way to do this is to integrate with the behavioral health team components. Many programs may have a wide variety of multidisciplinary programs where you have behavioral health, you have substance abuse teams, you have the clinical teams, the medical providers, the nurses, the prescribers. You can have a vast array of individuals within these teams, and being able to have the employment services integrated with all those teams. You continually change the structure by always having these champions talk about employment. And employment is always a great step one to focus on recovery and the next steps that an individual has in their behavioral health treatment plan to improve and integrate more in society. Next slide, please. So here's some 5 components that definitely comes right out of the IPS fidelity element that we really want to have employment specialists have weekly team meetings. Now, this is not just where an employment specialist goes and sits in the meeting, spends their 10 minutes and leave. We really want them to be there the whole time so that they can provide their perspective and their expertise about change. Employment specialists are agents of change, and the employment specialist unit is an agent of change. And being able to have these individuals attend the meetings and listen to some of the clinical consults, they can use their toolbox and expertise to really focus on change and start the pre-conversation about who clinicians can think about to refer to the employment services team unit. We really want to see that active process of shared decisions, shared expertise during consults. We also want to see fluid documentation. There's the old saying, if it's not documented, it never happened. And that's the same in any process of change that we're looking for. We really want to see service documentation, and we want to see the employment specialist unit vocational program integrated with the main charts. Some programs still have separate processes for tracking charts, and many programs are transferring into electronic health record systems, which even makes it easier. That way prescribers, clinicians, therapists can see the broader expanse of change or appointments and continuity of program attendance that is going on. We also like to see that employment services offices are in close proximity. If people are close, they're going to engage. Definitely this was going on probably more pre-COVID, where you would have those water cooler moments, conversations over coffee, maybe conversations in receptionists, where there's just a lot more dynamic interaction going amongst many people within the agency. And the last critical piece is that the employment specialist really helps people think outside the box, next steps, what they can do differently to help the client achieve their personal goals. Next slide. For treatment team integration, we know it can be really difficult for employment specialists to go to team meetings. So for a high level of fidelity, we really like to see people not assigned to more than 2 mental health teams where they get 90% of their referrals. That just really strengthens the bond of the referrals from the clinicians and really integrates the employment specialists into that team dynamic. Next slide, Don. Zero exclusion is really focused on client choice. We really want to honor people in their recovery journey, and we want to honor their choices. Many people have choices every day that they have to decide on, and taking away that power of choice can be really detrimental during the process of change and that process of a full recovery process and journey. That we don't want to have any of our own prejudgments as a clinician, as frontline staff, that would limit somebody's ability to move forward to attain their goal. And we realize that people can return to work regardless of diagnosis, regardless of their compliance on their medication, past work history. Maybe there's some family issues, or people are homeless, or maybe they're currently self-medicating with a substance. Those are all very valid clinical pieces that need to support and to address and re-education. But we don't use that to hold people back from moving ahead. Honoring zero exclusion really is a powerful culture change for the employment service unit to work with throughout the agency. One example I had when I was providing program manager duties at a community-based organization in King County, that one of my employment specialists had a client who was really determined to return to work. He had some very serious trauma from a self-inflicted gunshot wound from a suicide attempt about 15 years prior, had been trying to utilize different services to attain his goal of employment. He had a schizophrenic diagnosis, was on some medication, but was very heavily self-medicating every day with marijuana. So the staff did some education about, if employment is a focus, we need to really learn about different employers' onboarding practices and learn different business opportunities that might fit his needs and his ability to learn tasks. Through some informational interviews and going out to employers and helping the individual with some applications, this employment specialist was actually able to get this person hired in a manufacturing environment. But because the employment specialist knew there's some cognitive issues and some interpersonal relationship issues, she was able to advocate for an accommodation for her to be in the production line to help educate the manager about some of the strengths of the individual and some of the supports and needs. So she was very involved and integrated in the startup process. But the person was able to meet their goal to get hired in a production environment and start earning his livelihood. So there are some times where we invest even more time to address the needs, but we wouldn't see some of those extraordinary outcomes and changes in people's lives unless we start that process when people are interested to return to work. Next slide. Individual choice. It's all about client preference. And there might be some times where we think that there's no way somebody can do this. But part of the career profile really focuses on what is somebody's dream job. If we could take away barriers and limitations, what could somebody achieve? Now, I'm not saying that somebody comes up with a job and they're necessarily going to be able to attain the job they want, but it's up to us as employment specialists to look at resources and help people be educated about the process. There are times where people have some very high goals. I remember this one lady I worked with wanted to be a driver, but she had no driver's license, so there was a lot of work in terms of just getting into the testing facility, getting her permit, working through the testing with her. It's a very stepwise production, but she was very focused on that goal, and there were things that we could provide to support her with that. There are going to be some times where people have to decide, the individual, are they going to disclose to an employer? Can that employment specialist continue to provide robust assistance on the job? That will, again, be the individual's choice, but at least we create the framework for a roadmap to help people get to where they want to be. One of the agencies I was able to review, somebody was really focused on wanting to work around airplanes. It's a very secure, very competitive environment, but this person was using substances to self-medicate. So there was a lot of education there that the person wasn't going to be able to meet that expectation unless they made some life changes. That's again going to be a client choice on how they're going to move forward and what changes they're going to do to implement that so that they can reduce some of the barriers that they're facing and move ahead with their employment goal. Next slide, Don. Again, client preference goes hand in hand with individualized job search. We want to make sure that for the success of the individual, that employment specialists are really going out and looking for opportunities that match the job that the client is presenting to them. We might see that job goal within the career profile. We might see that job goal later in a job search plan, but we definitely want to see the continuity. And we know that people change their mind, but we also want to kind of see some of that process where people are changing their mind and changing their goal. Definitely, we want to see that specialized interaction with employers that match the job goal rather than just going out and knocking out all the fast food positions or the service positions, but more individualized that match some of the strengths that were originally placed within the career profile to start that job search experience, or even some educational experiences. I know there's some times that people might want a position that might entail safety, like a flagger or forklift operation or a food safety certification, that we can provide that additional support where people can do some of that and then move ahead with those specialized job goal searches. It's really important to have a plan, a job search plan, whether it comes in the form of the career profile that's at the IPS Works website, or additional updates to the job search plan, so we can see the pathway and the roadmap and what the employment is doing to get to the job market that's going to meet their needs. Next slide. Excuse me. Having information that's up to date and accurate is helpful in any journey. I know when I start a camping trip, I have a list and I want to check those kind of things off, or I'll have my Google or my Waze that kind of gives me a guide to my destination. A real important piece of that is, how will income impact somebody's current benefit? These could be federal benefits in terms of Social Security. They could be Medicaid, It could be Medicare, it could be VA benefits, it could be housing, it could be SNAP for food assistance. Many of these programs have elements when your income increases, there's going to be some direct impact on people's benefits. And education will help the client decide what is the next step in terms of meeting their goals and balancing what they need. And this could be in terms of people deciding they want to work, and income could impact your DSH benefits, but also learning about the portfolio or the additional benefits like healthcare for workers with disabilities, that people can work and maintain those benefits that they need so they can continue to be integrated with their safety support network. I had one client who just wanted to work part-time, and he was on Social Security disability, and he knew he could make up to his SGA because we did some education and we got the BBQI from Social Security, so we could use that as a basis, as a roadmap, and provide that to the client. And the client was working part-time for about 6 months, and then changes in the employment site that he was doing so well that he could add hours. So we had to do some education about the next step of work incentives with Social Security. The prescriber was not very supportive of this transition because they were really concerned about what would happen if the client lost benefits. One of the backup plans was work incentives through Social Security, but there was also benefits through the employer that the client could transfer. So even as the client is making headway in a process, there might be other voices that impact a client decision that people might actually be saying, don't move ahead or don't honor your goal because there's risks. And there's absolutely risks, and that's why this is such a critical piece. Now, the healthcare authority does have the healthcare, some benefit counseling information on pathways to employment. So I think that's going to be part of some of the resources at the end of this presentation, where there's a separate section where you can work through different scenarios and wages. I know this position is very critical in the return to work process, but I know it's also a struggle for agencies to send people to training and have certified planners. So definitely that is a free, accessible site for all the contractors that we work with and the general public, as well as vendors report that they send individuals to the Division of Vocational Rehabilitation for additional support and counseling for benefits planning. Next slide, Don. So this is definitely the exciting part of the IPS principles, because we want to see people saying they want to work to get through that initial assessment and career profile, and then actually going out in the community and starting the process. You know, it's can be a really exciting process, and really honor and value the choice that the client is making, that if I say I want to work, they're actually seeing their support system transition and move into getting a resume done, targeting different employers to match their strengths, abilities, and goals, and starting that process to go out in the community. So it really reinforces to honor the client choice, and that this is a very serious step in the return to work process, that they're sharing that information with you, and the employment specialist is initiating quickly in terms of making that goal happen and starting that process. That could be starting with informational interviews with employers, where you can practice interview skills and learn different aspects about the employer. That could be engaging at a work source. That could be engaging in job fairs. Just that process to get you, the employment specialist, or you and the client out in the community to start that discussion process and engaging with employers. Next slide, Don. A very critical part of any program, especially an evidence-based program where they measure outcomes, is tracking systems. That successful IPS programs that meet high fidelity have internal processes to track information. There's a lot of specific data during an IPS review that we look at within the supportive employment programs. We look for the first contact coming into the program. How long did it take from completing that career profile that people are engaging with employers in the community? To meet high fidelity, we really want to see that 30 days or less. And we know sometimes it might take a little bit more time, particularly during a pandemic. There's so many safety issues and just a lot more fear for people to make that transition in the community. But we really want to see that robust program development, excuse me, where people are getting through that initial career profile, already looking at different employers to connect that individual within the community. Thanks, Don. Part of this process is definitely, there's a system in place that we look at work preferences, strengths, skills and abilities, and getting out into the community. We really want to focus on the client's needs and matching up best with the employer's needs. Just in my program management experience, we have found great job retention outcomes when we're able to match and dovetail those needs together. This is a systematic process where we're gathering information and getting job opportunity information to the client and assisting with that connection. And these days, some of that connection could be virtual interviews. I realize there's a lot more things going on online because we're in a pandemic, but definitely the principles about IPS is focused on face-to-face relationship building in the community with employers, bringing them candidates to those sites to continue to build that relationship, and giving people more information about their potential choices that they're making for employment. Next slide. Systematic job development means tracking data, and it really means weekly looking at where the employment specialist is spending their time. As a manager and supervisor, this is a critical supervisory tool. It's a critical unit meeting tool. Some of these things can be discussed with a group, with a team, and definitely individual. I really encourage all program managers to use this tool as part of as their supervisory tool to see where people are and to track it as a program and to discuss it, to normalize this within the program development and the program function, that the expectation is for every employment specialist to have a certain amount of contacts per week. The magic number is 6. Through the evidence-based program, it's demonstrated that many contacts will lead to successful employment for program participants. We definitely understand there's going to be an average, and we look at that average when we look at this element during a review. But we really want to see that robust development in the community to achieve high fidelity, and that every program has a tracking form. Definitely, this is another plug for Pathways to Employment site, that there are some structured tools to help programs initiate some of the tracking and some of the metrics that we're talking about here today. Excuse me, next slide, Don. So I've gone through quite a few of the principles, but we know that on top of the principles that we're working with, there's also some different things that we look with for high fidelity programs. That the IPS Fidelity Scale, if folks haven't downloaded the manual or kind of downloaded the scale, I really encourage you to go to IPS Works to do that, so you can look at all 25 elements. And these are some of the additional elements that we work with, because we want to see diversity of employers, and that kind of really reflects how the Employment Services Unit is integrating into the community. But we also like to see different job types, whether it's cashier, customer service, accounting, drivers, custodial, food service. It could be IT support, all those kind of really diverse job types. And looking at different programs, when we go out and review, you can really see diversity of jobs and diversity of employers really makes the employment program even stronger, because they're building so many relationships out there. We also see time in the community. This is another tracking element. It can be difficult for programs to change and adopt, but that's another thing that we measure in terms of an outcome-based program. We want to see that programs are tracking this, and this could be tracked individually during supervision and can also be part of a unit weekly meeting, just to maintain that conversation and encourage people to be in the community as they're doing job contacts. Again, consumer choice and honoring that choice is important. The job search that we talked about, job development, we want to see frequency. Quality reflects back to jobs that employment specialists are seeking in the community. Do they match the strengths and abilities and desires of the candidates? Next slide, Don. Support. This is a critical piece of when we get a job, what happens next. That we definitely look for the employment specialist, the employment team, to provide individualized support to the individual. Before they get the job, we want to see that robust connection, and we want to see even more to provide that ongoing support. And we realize some of this is going to be client choice and the gauge of disclosure that somebody is going to agree to once they get their job. But time unlimited support isn't just limited to the employment specialist or the supportive employment team. There could be some natural supports. They could be family. They could be spiritual organizations. They could also be different advocacy groups that people come to and get support. They could be NAMI. There could be some peer focused support groups that they encounter. They don't all have to be at the actual behavioral health or the substance abuse site that's providing the primary treatment. It could be more of a community support. There was one person, I got a job back in my job development days. I got him a job at Costco, and I thought, oh, this is really cool, but it's a big warehouse. It's going to be really stressful. But once he started the job, this person had a great disposition that they were asking him about sports, because he had played sports in college, and that they had a softball team, and they actually asked him if he would want to be part of that softball team. I think that's a great reference to national supports could even be within the work environment through co-workers or organizations and activities within a company that they might have availability. I know some of that is going to be severely limited right now, but some of these supports could also be virtual, in terms of virtual support for people to get that extra support to maintain employment, or even move to another job that might be higher paying if somebody decides that this is no longer a good fit. That additional support could be when somebody loses the job and they come back in through the program to help with another one, or maybe they feel undervalued, maybe underpaid, or management changes in different positions and they need a better fit. That we also have that availability for people to come back to the program, get some redirection to find a job that better suits their needs. Next slide, Don. some of the information I just referenced is it takes a variety of supports to be successful in their job and during the process. There may be many different clinicians within an agency, formal or even informal, that help people on their journey and maintain their success into employment. But we really want to see you know, the preferred jobs and honor that client choice. But we also understand that IPS also has the ability to provide supportive education services, because for some people, in advanced degrees, advanced training might be part of the plan to get to the ultimate goal that they want. You know, just an example would be Amazon. I know when we were getting people positions in their distribution center, that they were changing the model where people, after a certain amount of time, could look at internal training so they could advance their career within the Amazon organization. So some of those unlimited supports could be internally. Some of those unlimited supports could be external through the employment specialist to kind of help them through maybe that training education process so that they can get to the career that they most desire. Next slide, Don. Enhanced supports and coordination care can include many different avenues, many different agencies. It's just not behavioral health. And it's really exciting today talking to all of you, because I know attendees today are part of different organizations that are looking to implement this exciting. So we know it really takes a village of a lot of different non-traditional programs. It could be NA, AA, recovery cafes, food banks, natural supports, there's family, those type of things that support people in their transition. It could be resources maybe through the Division of Vocational Rehab that could open up some doors, or maybe more formal education, helping people with that process to get certifications or degrees as we help them with survival jobs that match up with that. So there could be a whole nother tier through the educational system that we can enable to help with the coordination and provide that extra support on their journey. Next slide, Don. These are some of the specifics that we look for during an IPS review. This is another one where things are very prescribed, that for engagement with people for the job search process, we really want to see consistent meetings, and that there's some documentation that people, the employment specialist, the employment supervisor is meeting people before somebody has a job, that they're very involved with that job search process. We want to see there's some connection with the individual right after they start a job. It's a very narrow window of 3 days. And then we also want to see that robust relationship and contact for the first month. I understand as a program manager, I've had a lot of time where we just are doing engagement, we're texting, we're emailing, we're calling people to engage. And definitely these days in this environment, there's a lot more telehealth services going on, but we want to see that initiative by the employment services to make the connections, to see what's going on, how somebody's acclimating to the environment. Hopefully we can do that face to face, but we know with telehealth, we can also support that journey and check in to see how people are doing. You know, after a year or more, we understand that they may not always be engaged with the employment service unit. They might be engaged with the broader agency. I just had the pleasure of reviewing a clubhouse, and one of the participants had been been a member for over 10 years. So this individual was receiving the support of employment services, but they could also rely on those additional supports being a clubhouse member, which is going to be less formal than services through the supportive employment team, but nonetheless very important to maintain that social and some of the cultural aspects that a clubhouse offers. So that was a great scenario to see that they're able to provide those long-term services for year upon year upon year with their agency. I think that's definitely unique with the clubhouse model. And some of those services could be stepped down, but the overall engagement is really important. Oh, that's okay. I was moving ahead. Thank you for your time. Are there any questions? Anything in the chat box?
I'm gonna open that up now. I think it perhaps covers the rest of what we're doing, but I'm gonna open up the chat box. I see that we still have the responses when we asked about audio and video. Bill
Okay.
says, will the slides be available to us? Yes, they will. We'll make sure to send the slides out to you. We'll also send a link to the recording. I'm laughing a little bit because we got off to a rocky start, but Darren's been doing a nice job. So the recording will have that rocky start in addition to the nice job, and we'll send that link out to you. If you have questions, do please feel free to put them in the chat box at any time. We can answer some questions as we're kind of going along, depending upon the presenter. I like to do it that way. But if you have questions at this point in time, do please put them in the chat box and we'll answer them. I will say, I see a great job, Darren. I agree.
Thank you. Thank you for navigating
nice
with me.
You're welcome. It's nice to be able to recover after the technical difficulties that we all seem to have these days. So Diana,
good morning. Talking about technical issues. This is Lisa Bennett Perry on the call now.
Ooh, Lisa's in the house.
Yeah, good deal. So I see a question from Diana. If a patient finds having a phone which is important to have in case of an interview or reminders of appointments, what should we say? This much like, my 2 cents worth is this much like anything else is individual choice. If they opt not to have a phone, they opt not to have a phone. I would ask them, how would you like us to get in touch with you? What's your preference in regards to the way that we're going to meet and keep in touch? And once again, put it back on them in regards to choice and see what they have to say.
So I think that's a good point, Dawn, because sometimes it might be also to encourage the person to look at some options, whether leaving messages with a family member, or using some communities have community voicemail, or maybe email through connections at the library. So at least coming up with some options and reinforce that client choice. If that's how they want to present, it might be early on in that relationship developing, and educate them about some of the challenges that limitation puts in that relationship and job development process.
And much like a number of the other things that are based on choice, but maybe don't work out for the person, over a period of time, they may see that it doesn't work out for them to fail to have a phone. And so, they need to have the opportunity to experience that and decide what's going to work best. And so that's one way of dealing with it. Anybody have other ideas in regards to how they might deal with that? And feel free to use the chat box if you'd like to do it that way. We can also unmute you. I say that, we will try and unmute you as needed. I maybe should knock on wood or something along that line here. So while you're thinking about that, the scenario today is that we're taking 2 15-minute breaks. When we're done with this segment of things, we're going to take a break. And then Lisa, I'm assuming you'll start your presentation after the break. And if not, let me know. We'll go back to the beginning of the slide presentation in order to be able to bring up Lisa's slides.
Thanks everybody for being flexible. We're hoping for the rest of this is it's going to be smooth. So yeah, we had that 15-minute break. I'm assuming that you did the housekeeping in the beginning since I wasn't on the call.
Yeah, you certainly, Lisa, if you have other housekeeping items, I know you're going to talk about A19s and that kind of thing. We did not do that piece of things. So by all means, when you start your presentation, that would be important to go over.
Okay, perfect.
All righty. Not seeing any other questions. Why don't we adjourn for a 15-minute break? I have that it's just about 9 o'clock, so let's be back at 9:15, please. And I would highly recommend you leave your computer and this presentation going while you're gone, and to avoid any problems if you tried to sign back in. So thank you so much for your attention to this point in time, and we'll see you at 9:15. All right. And Lisa and Darren, just to let you know that folks can still hear our conversation, because I'm leaving mine going too. Well,
I'm just kind of reflecting back. I talk about choice and support. So I really support, I really appreciate the support for my team in doing the presentations and all the tools, that no matter what we do in life, it's always good to have great coworkers or great friends that kind of help you through any situation.
amen to that. And I have to say, we have a good supportive team, so that makes a big difference. Lucky
It
that
does.
way. Let's see here. I'm looking through the attendee list, and I was just looking, well, because I think when I am presenting my screen, I am not certain, but what the chat box shows up for everybody, and I guess somebody could send me a chat and let me know whether it does or not. I haven't brought up the chat box because I'm afraid it's going to cover up the slides. So, Darren or Lisa, you could tell me what you see because I'm presenting the screen and I have the chat box up right now. Do you see the chat box in the middle of things?
I don't see it. No.
I don't see it in the middle of things.
Okay, and Deborah says cannot see attendees nor chat box. Good deal. So that's interesting. And actually it's good news, because that way I can check the chats even as I'm doing potentially my part of the presentation. So I appreciate knowing that.
So
go ahead.
So was Darren not doing the slides because you were having issues giving him the controls?
No, Darren is still in that learning mode, and
okay, I just wanted to make sure. So the VPN wasn't when I came in, and I remembered you say something about the VPN. So I went out of my computer, closed it down, came back in, did not turn the VPN, and was able to log in, no problem.
Yeah,
Oh.
yeah, that was part of the discussion we were having yesterday. Was when things go south, the IT team had said, get out of the VPN, and that it works better that way. So it obviously did. That's yeah. Yeah. Jenny says she does that chat box. So I'm not sure what the difference is there, but that's good to know, Jenny. Thank you for letting me know that. So whoever's presenting their desktop can't have the chat box open. So we really need to, whoever's presenting at the moment needs to have the slides on their desktop, and then so one or the other of us who's not presenting can bring open the chat box and keep track of what people are saying. Deborah says VPNs are like traveling through it. Sometimes it clogs up the signal. Ain't that the truth, Deborah? It did this morning.
So
anyway,
could you change these presenters? All right, looks like I can just take it. And I'm going to show my screen because I'm actually going to just, my big thing is I'm going to show the different
Right.
resources.
Yeah, you need.
So can you show
Yeah.
my screen? Can you see my screen right now?
Yes, I can see your email box.
I see
Okay,
your
I don't
email
want you to
box.
see that. I don't want you to see that. I want you to see, I'm going to pull this over. How about now?
There you go. Now we got it.
You
Now
see
we got
happy
it.
people.
Okay.
Oh.
You see happy people?
We did. Now we see a laptop.
Look at, I'm right there. Hurry up really fast. I'm right
Where's
there. Right there. Right there.
Thank goodness for arrows.
Yeah, see?
That's a great smile.
I'll work on that.
You know what? And I'm pretty sure I'm in there and I'm standing behind a tall person, so you can't see me.
Yeah, I'm looking for you, but maybe you're standing behind a tall person.
There, I was in the picture and just find a tall person and then see if there's somebody crouched behind them, because that's me. All right, I'm going to take a couple of minute break. I will be back, and that's fine since Lisa, you got it. We're all in good shape anyway. So I'll be back in just a couple minutes.
Me too. I'm going to warm up your coffee.
The good plan. Is it working for you, Lisa? I can see IPS works on the.
I'm looking for the toolbar on the screen right here, and where you, yeah, exactly.
Oh, for heaven's sakes! Yeah, nope, it's not there, is it?
Hey, Don or Lisa, somebody in the chat box was curious about what year the conference was that was on the IPS Works website.
Okay, we're in 2000. I think it's 2019.
Yeah, I think it was. If I remember right, it was this. You know, time is very strange these days. It's hard to remember what year things were because it seems like we've been in the pandemic for years. But it was last year.
Oh, thank you.
Yeah, they do them yearly in different locations. It was supposed to have been Raleigh, North Carolina this year, but obviously they canceled that. Hopefully there will be one in 2020. What's that?
What was the location of the one where the picture was taken?
It was in Colorado, Denver.
Nice.
It's 9:16. So do we look like we have everybody back? Is people ready to get going again?
Yeah, hard to tell whether folks are back because the names are still there, but I would go.
Okay. Well, welcome everybody, and sorry again for technical issues this morning. This is Lisa Bennett Perry. For you that don't know me, I am the Supportive Employment Supportive Housing Administrator for Healthcare Authority, DBHR. My role with DBHR is oversight to some of our homeless outreach programs, such as Peer Pathfinder and PATH. Peer Pathfinder is focused mostly on our substance use disorders, reaching out to individuals that are homeless and engaging them into treatment, such as medical assisted treatment, also engaging with hospitals for people that have experienced overdose or physical problems or health problems related to substance use disorders. And then our PATH programs are focused on individuals with mental illness, on co-occurring disorders, but again, that are homeless or at risk of being homeless, and engaging them into services. I also have the pleasure of oversight of such programs as clubhouses and other peer-run organizations through startup funds that we were able to access starting in 2018. Of course, there's an emphasis on supportive employment and supportive education in that. And of the 14 agencies that I oversight, 10 of them are contracted for foundational community support. 2 of them are in a process, and 2 of them have made the commitment to connect and build a referral process. So not actually provide the services, but build the relationship with their local foundational community support agencies to provide the services. Prior to my current role, I was an IPS trainer. I was a super employment IPS trainer like Dawn and Darren are now. And so you can't, and then prior to that, I provided employment services and included support employment services for multiple years. So you can never get, once an employment specialist, always an employment specialist. So it's been really hard for me to let go. I do see support employment as a big piece of recovery And so no matter what I'm doing in social services, I'll always be a cheerleader for employment, so, and education. So the purpose of this training was to provide more tools and resources to our supervisors and our employment specialists. So what I wanted to cover today is all the tools and resources that are available to you. Hopefully what you can see on my screen right now is the IPS work site. So as Darren said and Donna said in the past, is that these are the creators. These are of the IPS model. These are they did all their research. I want you to recognize, I don't know why on the top of the screen, there's a toolbar, will give you a lot of different resources. So I just want you to be aware of this. We're going to enter this in our follow-up when we include our webinar, we'll include the slides. We'll also include all the links that we're going to talk about today to make sure you're able to look through there. There's going to be a lot of tools, but one of the things I want to emphasize is IPS or WESTAT actually has their own certified IPS trainings. And one of the things I did in the past when I first came on to DBHR was I had oversight to a grant. It's called the BEST grant. And that included 2 agencies initially that implemented IPS here in Washington State. And they all took the certified IPS training. And actually, it just became certified, so you can actually get a certification for completing it. But I want you to realize that is an option for you. It's not a requirement, it's an option. And that includes a supervisor training as well as employment specialist training, and there's actually one for trainers. But you'll be able to find, when you come in here, you'll also see a tab that says library. And in the library tab, you'll be able to find all their updated forms and videos, archived videos. And if you're really interested in things like research, they'll have all the research studies in there for you to review. You could be in there for hours. So again, we'll go ahead and share that link with you. But one of them that is going to come up is this one, please. Pathways to Employment. So one of the things we did when we were building this program out before it launched was to say, where can we get a designated area for our agencies that are newly providing individual placement and support services and or new to employment services altogether, but where could we get a targeted area that we could direct you to so you can easily find the needed forms that you need to build a program. So if you'll see here on Pathways to Employment, there's going to be a lot of tools that I'm going to cover, but I'm going to start with supported employment. And then provider tools. So in here, you're going to find a variety of different resources, but I'm going to emphasize a handful of them. So when you're starting your program, I'm sure you've already been thinking about this. What kind of forms do you need? What kind of tools do you need to engage with people and document what is their goals, and also document the progress that they've made. So the first resource you'll see is building your program. This is a SAMHSA toolkit on evidence-based practice, and it is going to give you all the detail that you could imagine in building your program. So please, you know, taking the time, reading through this as you're thinking through what your program's going to look like, and all the, I guess you can say, foundation, what you need to build off, you're going to find in your building your toolkit. Go back. Oh, don't do that. I just didn't handle it. All right, there we go. So we're going to start with a career profile. Your career profile is a living document that you are going to start your conversation with your job seeker about their basic information, starting out with just the, what is your work goals? This should be strength-based. It should be focused on what their interests are prior to what their barriers are. It's not uncommon when you go that people tend to jump into what their barriers are, the things that they need prior to them starting work, which is very important that you know what their barriers are. But when a job seeker comes to you, they're coming to you with, I want a job, you know, here's what my hope and inspirations are. And if the conversation on your end starts with, well, let's talk about it, I understand that you're homeless, or let's talk about it, I know that you just started treatment recently. That, again, is very important information, but you as an employment specialist really need to focus on the goals, the interests, the dreams, because they might themselves come in there with kind of, how would you say, with the idea that maybe this isn't possible, or that they've tried before and it hasn't worked before. So really concentrating on their strengths. So what is your dream job? What is your long-term career goals? What type of job do you think you would like or have now? Or because they might come in with a job, but maybe they're not satisfied with their job. So what has appealed in past jobs? What didn't you like about jobs?
Hey, sorry to interrupt, Lisa. We do have somebody with hand raised.
Oh, let me push on that.
It looks like Bill Snyder.
Okay. I'm sorry, it's hard to see it on my end.
Do you want me to? I can unmute him. And
Sure.
Well, I think what he's saying is the screen went away. So try getting out of presenting, Lisa, and then get back in again and see if that brings it back. I also see that Christine had said couldn't hear anything, and it appears as though she has left. So we're still having some technical difficulties. Do please feel free to continue letting us know when that's the case. Can you
see my screen now?
Yes.
yes.
Yes, it's up now.
My apologies, everybody. My apologies. Thank you, Bill.
Thank you, Don.
So we have an example career profile in the Pathways to Employment. This is directly out of IPS, as you can see from the heading. But we don't dictate which vocational profile or career profile that you use. We do ask that you make it strengths-based. And so here's a good example for you. You can either take this I call them vocational profile. You can take this career profile and you could just use it as is. Print it off, put it in each person's file, or put in your electronic file, and this could be your guide. And or you can go through here and say, for the people that I'm working with, I really don't think these questions really apply, and you can create your own. But what you do need to hear through this process is that you need to have a career profile in your file for each individual that you're working with. And another thing that I want you to emphasize is this is a living document. So when you're starting out working with somebody, you're going to ask them some of these basic questions, but then you're going to start your exploring with them. So it starts with asking questions a day or two, maybe your second or third session. Now you're heading out into the community and exploring what opportunities are out there for them. Because pre-COVID and right now things are easing up, you know, so there's people out there, there's more people out there doing more face-to-face work, but is that somebody might come in and not have a goal. It's not going to be as easy as what kind of job do you want. And it definitely shouldn't be, here's the job that we have. It should be the exploration of their skills, their interests, their past experiences, but also going out there and saying, let's look at what the job market is. And is this something you can see yourself doing? But what I've found to be helpful is actually going out there and even observing people working and saying, you know, could you see yourself doing this? You know, stop, kind of look around. Is there any triggers? And then during that how would you say, I used to call it windshield time, you know, maybe if you're driving down the road with somebody and you're having a conversation, you're learning more about them from that, from the non-formalized conversation. You're learning more about that individual. And as you're learning about them and as they're learning about themselves, you're going to update this form and add more information. You might start out with the individual coming in and saying, I want to be, I used to work in a restaurant and I was a breakfast cook. So I think that would be a good job for me. And then you're out there exploring, and you hear him or her say how difficult it is for them to wake up in the morning. And being a breakfast cook, obviously, would relate to waking up early in the morning. So, so then you have a conversation more about, well, it sounds like waking up in the morning might not be the best, you know, hasn't been the best for you in the past. Have you explored other things? Like if you like cooking,
Sorry, Lisa, I was just
yes.
That there's noise in the background, so please mute if you would.
So maybe you want to look at have you ever thought about doing lunches? And then there could be a lot of ors in there. So really getting to know a person and updating this as you go on. One of the things I also want to emphasize is if you don't update it and say for whatever reason somebody else picks up this file and it wasn't updated, then that communication goes out the window. And also if we're looking at individual choice and we're doing reviews, of course, for the quality and the improvement of these programs, we're not going to know that individual choice really played in if you don't update it as well. So it's important to update these. But it also to emphasize that you don't really need to feel the pressure to get, how many pages is this? To get to the bottom. Quite a few pages as you go through here. To feel like you have to get every one of these answers done before you can actually start with doing that community exploration with individuals and adding information as you go. And some people, you might be able to get this done in one session or two. But again, listening for those cues that a person might give you in that informal conversation. So one of the things we were going to look for, you're going to want to pull out and start looking at, if you haven't already, is a career profile for your agency. Okay, let me get back to my screen here. Now job search plan. Let me get to that one. Follow along. It was funny, I couldn't see it. Oops, don't do that. There we go. Here's a sample job search plan. So you have a vocational profile, again, 10 pages long, you're adding information to it. One thing I found over the years, and obviously IPS has found over the years for the research, is how important it is for individuals to feel like they've accomplished things readily. So we have these huge goals, and there's a lot of steps to take to get to that huge goal. But to be able to feel like you made progress, how do you break down those small steps and celebrate those small or those successes? Because to an individual that hasn't reached goals in a period of time, they really need to have that celebration. So it's also important to realize that the job seeker has a role and responsibility in their recovery, in their employment planning, but also the employment specialist, the employment program also has a responsibility. So in the job search plan, you're going to break down small steps. It doesn't need to be 10, maybe it's only 2, maybe it's 1 for now. But break down the steps of what you're going to be responsible for and what they're going to be responsible for your next meeting. So they come in, you complete their vocational profile or the career profile. I'm sorry, I keep flip-flopping. But what is your next appointment going to be? So you sit down, you write down what objectives are, who's responsible for them, and then the frequency, and then the target date. So for this person, this job seeker, the first objective was to create a list of businesses that the jobs that Kenya, in this case, the job seeker, is qualified. So before Kenya leaves, before your next appointment, I want you to really create a list of businesses that you'd be interested in that you feel like you're qualified for. And so on their next appointment, in this case, was going to be August 15th, they come, that's what they're doing while they're gone. And when they come back, they're going to review that together. Now, Kenya and the employment specialist in this case are going to work on a resume. That's the goal that they're going to complete on August 30th. So to break down the goals of who's responsible for what. So then maybe Marisol, looks like the employment specialist, is going to contact employers on that individual's behalf, start in September and ongoing until they're employed. And this is how many contacts they're going to make. They're going to they're going to be weekly, at least once, I think is the way it's broken down here. And as you complete goals, these drop, you make new goals, and so on and so forth. But these could be broken down, and maybe the first goal is the person says, I really want to work, but I really think it's important that I get my high school completion, so I'm able to put that on the resume. That's always been a barrier for me. And so the next meeting is going to be to review what kind of opportunities are out there to complete a high school diploma, and so forth and so on. So that would be the employment specialist is going to do that, and then breaking down those steps. So that's a sample job search plan and the purpose behind it. Going back to where it was. So far we have a career profile you're going to want to have, and you're going to have a job search plan. Now, it's going to be important also that during this time that you're also having those discussions about what you will say and what you will not say to an employer on their behalf. So early in the discussion, during the vocational profile, actually, you're going to have a discussion. So when I'm out talking to employers, what can I say? Or do you want me to approach employers on your behalf? Some people are going to say, I don't need somebody to go out and talk to employers on my behalf. I just need the support in the background with, you know, ideas of where I can look for jobs. I need help with a resume, and so on and so forth. So you're going to want to note that in your case note on this form, that the individual says, I don't want you to job search on my behalf. That's going to be important as well. You're going to maybe revisit this. Maybe they've started looking for work. They haven't been able to find work in a period of time. They're starting to get frustrated. So you have a conversation of what you might do. So instead of, do you want me to disclose could be disclose your current treatment schedule would be an example. So when I provided services through Thurston County Jail, everybody that I served was doing either in drug court or in outpatient. So when they're out their job developing, one of the things was going to be affected would be their schedule. There were certain days they absolutely had to be at their treatment. And there wasn't any flexibility. Drug court wasn't flexible. You had to be there every Friday. So maybe the conversation on their behalf was going to, the disclosure piece of it would be, is this individual is in treatment currently, and that was all that was disclosed. Or it might be that this individual has in the past, you know, he suffers from anxiety, and although, you know, she is doing great now, and of course, before you're seeing any of this, I need to backtrack. You've already marketed them to the guild, okay? You've told them all the great things they have to offer you at them as an employer. Okay? You never start out with this. But at a point when you're talking about what kind of support the person might need, there might be some disclosure, but you're going to want to talk about that beforehand. So this is the form. It'll give you some detail, kind of some talking points and possible advantages of disclosure and the possible disadvantages of disclosure. But give them some examples of what you would say and what you might not say. Sometimes disclosure is how you're going to get the support that an individual needs to be successful on that job. Granted, I've never given a diagnosis. I have given symptoms, depression, anxiety. I have given a person is currently in drug court because that person had very strict guidelines of what they had to do, what they couldn't do. Also, the individual had everybody I served had criminal backgrounds. So not that substance use disorders are an excuse for criminal behavior, but it does describe when you have to disclose a criminal background that a person is doing something on their behalf that is, you know, going to decrease the likelihood it's going to happen again because they're in treatment. So being in recovery is something to be proud of. And although there might be stigma behind it, it is something to be proud of. So, but again, it's not up to you as an employment specialist to make that decision for them what you disclose. You're going to want to have those conversations prior to, and or coach them on how to disclose that information in a way that it doesn't minimize or justify, but it reflects on their commitment to the recovery. Then follow-up plan. Oh, one of the things that Darren described, of course, the importance of follow-up plan and the diversity of what follow-up might look like. As Darren said, and just reiterating, is that the conversation about what follow-up support looks like should be talked about early in the planning stages. And now it's going to think about pulling it up. But early in the planning stages, you should be talking about what kind of support the employment specialist is going to provide the individual, but also what kind of support they can build around them. You don't want to wait till somebody gets the job and then start talking about it. A lot of agencies might say, well, they didn't want that support. But if you start the conversation early on and the benefits of that support, you're more likely going to get people to stay engaged for longer. Also, don't forget that follow-up support is as important with that employer as it is for that individual. And let me describe why. If you're providing follow-on support to that individual, and maybe you don't go on site, maybe you do go on site. It's really going to be based on individual need, that type of support. So that's a conversation you're going to have with that individual prior. Maybe in the past, the individual, when receiving training, traditionally became overwhelmed. Memory is really an issue. And so having an employment specialist on site, taking notes and providing that support helps them initially while they're going through that training phase. That's referred as job coaching. And it's not as frequently used maybe with individuals within behavioral health and more in developmental disabilities, but in my past experience with individuals with serious mental illness, it was a common thing that we did job coaching. I think it was a little too common, to be honest. I think we really need to individualize these services, meet in person before work, after work, you know, through their, especially during the first couple weeks of their, is going to be really critical that you have that plan in place. I don't know why
Lisa?
the form's not actually pulling up. Yes.
All right, I was going to say Hannah said not seeing current slide, and in fact there isn't one because sadly the site isn't pulling up the form. So
yeah, I don't know what it's doing, but it's not pulling up the form. Let me go to this one and see if this one comes up. There we go. It just did that circle. You know what circle I'm talking about, the one that's thinking about it. Okay, this one's coming up. So this is what's the follow along support. This is an example one. So what kind of information might you need when for your first day? What kind of preparation can we make? So that might be the conversation about transportation and clothing, and then what kind of support they need, and then the first day of work. So the conversation is the first day of work, the employment specialist will meet them 15 minutes before the start of the shift, and then meet them at the end of their shift. Maybe that's what you decide with your job seeker at that time. Here's a kind of a breakdown of transportation, communication with the supervisor at work. So we're going to we might talk about that. If anything that you get from the follow-up, I can emphasize the importance of that relationship that you maintain with that employer. When there's bumps in the road, and there'll be bumps in the road, that check-ins that you're doing with that employer over time, it might be 2 minutes. Hey, Joe, how's it going? I just want to check in and see how everything's going. Everything's fine. Great. Have a great day. It might be something like that. It also might be you kind of get that formal kind of chit-chat friendly stuff. That's great too if you can get to that level. But when there's a bump in the road and you're able to go to Joe and say, hey, Joe, there's an issue I need to talk to you about. Remember when I told you, well, it looks like it might be 3-4 days before this, whomever the job seeker is, can return due to some medical issues. And that person doesn't lose their job because there is that issue. I've had people that had to go back to jail that I've been able to communicate. I've had people that were going through medication changes, and being at work would not been a good idea. So if you didn't disclose, it'd be really hard to have that conversation. But if you did disclose, even if it was minute, what you said to them, it's easier for you to come back and be able to say that. So communication with the supervisor at work. And then there's just breaks it down farther. Again, you can use this form, you can take information in this form, you could add more to the form. As long as you have a follow-along support, a job search plan, and a vocational profile in the file, then you're in good shape. There's also, I want to point out, there's medical necessity documentation guide. So how do you tie back employment services to medical necessity? There's a guide here. There's several trainings that happen per year. You have Darren and Dawn, which will be great resources for you to be able to support you in that area. So I want you to know that there is an example there. But before I run, is there any questions, Dawn or Darren?
Not new ones, but hopefully now folks will type some in, and I'll keep you posted.
Thank you. So I want to make sure, one of the things that Darren emphasized was benefits, how are benefits affected by employment. There is this great tool called the Benefit Estimator, where you could enter individual information, including household information, if they're married, their spouse information, income information, might be on SSI or SSDI or current earned income. You can use this as a tool to see how benefits are affected, and then calculate that information. So this is a really good tool for you. So I would suggest that you kind of play with this a little bit and see how this might best work for you. One of the things I do want to state again, in your vocational profile, in your case notes, you're going to want to document that you are providing each individual benefit planning. Not everybody's going to be on SSI, not everybody's going to be on SSDI. Some people come with absolutely no income, but they might be on food assistance, right? They might only have food assistance. And how might their food assistance be affected by employment? You're going to want to make sure that the individual knows that your food assistance amount will go down when you start working. Or maybe they're receiving some kind of rental assistance, a HIN or something, or housing for essential needs. And how might employment affect that? So it's not just SSI or SSDI. This is also for other benefits. We do want to show you continued education. Under continued education, you're going to see these modules. Just a second, continued education. Where are you at? Oh, sorry. These are peer counselor modules if you're ever interested in finding out more about how employment specialists and peer counselors work together and the roles, the important roles that they play. We have some great modules there. But I also want you to see the benefit planning training that was recorded. And we have one on SSI, Title II, Medicare and Medicaid, and ABD, HIN, and TANF. So basically, how benefits would be affected. So these are going to be great resources for you as you're trying to learn and best advise individuals that you serve. Here's another one, justice involvement. Here's another great tool for you. As you're preparing to support people that have criminal convictions, you're also going to need to prepare them and how best to disclose that information. Also, as an employment specialist, if you're not comfortable disclosing a person's criminal background, or if you're not comfortable talking about a person's behavioral health condition, then that's something that you as an employment specialist are going to really want to, I don't know, practice how you can disclose this information in a way that, of course, you're always emphasizing people's strengths and skills and what they have to offer an employer to be able to have these conversations. There's a tool. I need this thing to go away. Go away. Okay. A disclosure statement and a template that you can have people, and it gives you an example of what you might say, but that you can help people fill out for themselves as a way for them to practice what they would say to an employer, but also suggest as an employment specialist. What would you say to an employer? How would you introduce that? How would you talk about a person's positive change and their experience and the advantages of hiring somebody with a criminal background? If you wanted to emphasis on work opportunity tax credits or bonding, if they apply to that individual, and so forth. So here's some other great information that you can utilize. Well, it looks like we're about 5 minutes to the end of my portion. Is there any questions? If you could raise your hand, we could unmute you, or.
Hey, Lisa, you actually get to go till 10:15 because you started right after the break. So if you have other stuff that you need to cover and haven't had a chance to yet, you would have some time to.
Well, why don't we just go ahead and unmute people just for a couple minutes, Dawn, and see if anybody could ask any questions.
Let's see if this works. Okay. Theoretically, everybody is unmuted. And if you've self-muted at the other end, you've also got to undo that. If you have any difficulties with actually being able to talk, let me know and we'll try again. But like I say, theoretically, at least you're all unmuted. It depends on whether you're also self-muted at the other end.
Okay, Okanagan Beaver Health, we're going to use you as a tester.
Here we go. So I think that you are calling me Bill. I'm not sure that Bill is on the line. He might be, but this is Kathy, the clinical director from OBHC. And we don't have the chat box anymore, but we can hear you pretty clearly, and we have this screen. So those are all positives and great information that you guys are.
So you're saying you couldn't ask a question if you wanted to right now?
Nope, I can't ask questions.
I think Bill is in fact on, or at least that his name shows up, and maybe that's you talking with from his log on. I don't know.
I don't know either, because I'm in my office on my computer, but the things that I have put in the chat, you have responded to Bill as if it were him. So maybe we ring in that way. I don't know.
Yeah, I'm thinking probably you used his log on, and that's why it identifies as Bill.
All righty.
And that's all right.
That's okay. I still am getting the same information, and I'm very thankful for it.
Exactly.
Thank you.
Good.
Thank you. So of all the tools, has there been anybody that has been on for Pathways into Employment yet? And maybe share what how you've used Pathways. Okay, well, maybe this group hasn't been on Pathways yet, and you have a really good tool for you now. So have agencies started building, I'm going to call it being old school, files yet, or is this going to be helpful for you building your files for each individual that you serve?
Lisa, this is Lisa with OBHC.
Hey, Lisa.
Excellent.
Hi. I just want to say, because I've been playing around with the websites while you've been talking, and this is an incredible help. So thank you so much for these resources. I've already downloaded several forms, and it's nice to not to have to reinvent the wheel. Thank you.
Well, I'm somebody that has what do you call blank page syndrome. I have to borrow still from wherever I can, and then I make it my own. so I mean, because I honestly, when I look at the career profile that IPS does, I mean, it's like I totally would just grab it and just started burning them off. But there's some things about it when I've reviewed them through fidelity reviews and so forth that I can see that I would want to change, or maybe delete a couple things that you know, maybe I didn't feel like was necessary to condense it a little bit, or add a couple things that would be individual for that agency to it. But definitely when you're starting out a new program, it's just a matter of getting your tools together, and then you start making improvements as you're going on.
Absolutely. I do the same thing as you do, Lisa. I get the creative juices flowing, and then I'm okay. I wanted to mention too about the IPS Works library, which was being uncooperative this morning. I was on there last night, and they've actually added a number of new tools, things like you know, job development during COVID, and we have webinars and things related to that to try and help employment specialists, because it's hard right now to figure out how to talk to employers. So we have resources for that. But the IPS Works library has things like a white paper related to IPS in rural areas and some of the considerations. It has the Fidelity Reviewer Manual, and then it has a Supervisor guide to how to use that manual. It has just a boatload of different things. It has their newsletters with different articles in them. It has a Youth Fidelity Scale if you have any programs that serve youth and want to start doing supported employment with them, because you can work with youth in SE from 16 years old up through adulthood. So it has the Youth Fidelity Scale, which differs from the Adult Fidelity Scale. Between Pathways and ipsworks.org, there are so many things that would be helpful for you to look at, read through, and be able to access forms and things. A lot of the stuff on the ipsworks.org website is downloadable, and I may be sharing some of those things when I send out the thank you for attending email after this, along with the slide. But just be aware, if and when it actually decides to behave itself like it didn't today, with not having the, you know, the kind of the toolbar up above, it's got just a boatload of material as well.
I also wanted to make sure not all agencies have contracted with AmeriGroup, but and or you're in the process of contracting with AmeriGroup. I don't know what amount of people have already received the orientation, but once you receive once you get through the contracting process, AmeriGroup will have that orientation with you, but I want to make sure that you are aware of all the tools also available to you as well. Okay, I need that to go away. I'm gonna move it. That's what we do. I'm sorry, I'll get there. I had it pulled up and that's not there anymore. There it is. Yeah. Let me get out of here. So there's a difference from what AmeriGroup is going to ask you to do because of as the FCS, MCO, Medicaid provider, right? They're going to want you to do very specific things. What we're talking about today specifically is about the actual services, the the evidence-based or best practice that we're emphasizing. We're talking about the forms for the program, but we're not talking about things like the assessment that for eligibility, for example. So AmeriGroup is going to determine eligibility. You on your end are going to determine eligibility, are going to ask questions to determine if you think that person might qualify for the services based on the quick reference sheet, for example, on who might qualify or not. But there's also going to be an assessment form that gets sent to AmeriGroup. AmeriGroup reviews the information that you provided them based on the information that either the individual given you or the information that you know because you work for a behavioral health agency, either or. And then that gets sent, they review it, and then respond with either you know, that a person does qualify and the individual's authorized for that next 6 months, so on and so forth. That's a different conversation than what we're talking about right here. So I want you to know that there is forms available that you can review. Also on the communication that's going to go back and forth from AmeriGroup and your agency. So they have the provider manual, break down FCS information. Here's the quick reference guide that I was just talking about on what qualifies somebody for FCS services and how to determine that. That conversation about reimbursement rates. So I want you to be aware of that as well. That's the assessment, the billing guidance, their forms, and additional resources. So again, when we send out the PowerPoint, we're going to also send out the link, and just in case you don't already have this information, and realizing that this is the relationship between you and AmeriGroup and what you need to do there. Does anybody have any questions about that?
I don't see additional questions as yet. I'm just curious, how many of you have already got your FCS contracts? That's something we haven't asked, and that is one of the deliverables you get to bill for. But I don't think we've asked as yet who all has been able to get through that process, or perhaps you already were. And if you were, that's still something that you get to bill for. I see our billing department is, Renee says our billing department's working on it, not RCCC in Vancouver. Vince had said that. So it sounds like at least some of you are still working on it. Keep us posted if you need some support in that area. And we have our contract administrator that will pull in for, just to let him know, and maybe for some assistance.
Yeah, we know a lot of agencies will reach out to us. Well, it'll be Don and Darren now, but will reach out to us and ask us questions, in regards to what's going on that might with their contracts and that type of thing. And if it's contract-related kinds of questions, there's some answers that we have. There's some answers we absolutely have. And then there's some, let's tie your representative from AmeriGroup, or let's find out who your representative of AmeriGroup is, and let's start that conversation just as this. So Darren and Don and myself can assist in some answering questions, but when it moves too far into the AmeriGroup line, then we're going to refer you to them. Doesn't mean we're not going to meet. We'll be in the middle of that. We might actually start an email chain to make sure you get your answer. So,
I like bringing in Matt Christie is our AmeriGroup contract administrator, and he's incredibly helpful. So very often I won't answer. I'll just funnel it right over to him to be able to help, facilitate. getting an answer for things. So that's kind of what I was thinking about too.
So I know there's going to be a lot of information in a very short period of time. This training is really just to get you started. We're stuck with this virtual kinds of trainings and not so much of the hands-on as I was always more accustomed with, and it actually took me a second even to get comfortable. Not a second, it's still not comfortable doing trainings completely this way. I'm more of a hands-on person, and I'm going to assume that some of you are as well. So at some date, Don and Darren will be knocking on your doors, and they're going to be really excited to be able to be there and to help maybe review files and see how things are going. And maybe they'll do a fidelity review at some point in your agency. You should be providing services for a minimum of 6 months before you receive a fidelity review, of course, but maybe you can participate and be in a reviewer at some point. So I don't know if that's something that they talked about, but part of the learning collaborative that we built is by incentivizing fidelity reviews to receiving a fidelity review, or actually being a fidelity reviewer on a team with one of our state trainers as a way of learning IPS or the program development. And I can't, the feedback that we've received over the time that we've been doing this is it really helps people see things from a different lens by being the reviewer versus being reviewed, because that can be uncomfortable no matter how often we say this is not a pass or fail. This is just about helping you continue with your building towards good fidelity. People do get nervous during that time frame. So that's something that you can talk to Darren and Don about in the future as well. Also,
Yeah,
there is, sorry, Darren, you can talk.
Okay, thanks, Lisa. No, I just really encourage people to consider that. It is a great way to get a different perspective and look through the IPS lens with different programs. And I've heard people, take away really important elements that they can go back and implement in their own program. And it's definitely a great way to be part of the learning collaborative and shared information and see different perspectives of how agencies are implementing different elements of IPS.
Yes, and also another, your monthly topical and job developer webinars every month that I would highly suggest you participate in. A place that you can ask questions and cover, there's specific topics each month. But there's just all sorts of different trainings that are going on. But definitely after this, feel comfortable to contact Darren and Don and myself in some cases. And so the training can continue. Please ask questions. I'm always afraid if agencies don't ask questions, honestly. The agencies that ask the most questions, generally do the best. There is no silly question. You're not expected to know this information right from the gate. So ask away. That's what our jobs are for.
Good perspective, Lisa. I can't agree anymore.
Your point is a really good one. And I guess I would mention too, not only are Darren and I available for questions, but as you get into things, if you discover things, some areas of this are more challenging than others, we can set up separate trainings for individual agencies. And obviously they'll be virtual at this point in time. But, if you discover that some aspect just is too tough to be able to handle on your own, we can do training with your supported employment staff or even with your agency staff. I know as a person who worked in an agency that had been doing supported employment and then started doing IPS, we did training for the whole agency. We did training for the therapists and the med team and the case managers and the whole agency, and talked about zero exclusion and what that meant and how to refer. And competitive employment, and all the different principles, and with the intent that they would bring up supported employment with individuals on caseloads periodically in order to find out if they're interested. Just because somebody says no now doesn't mean that they're forever disinterested in employment. So it is something that gets brought up periodically. And as an agency, we did have training for the whole agency. So if there are some of those kinds of things that need to be done at a later date, Darren and connection with the server's been lost, at least from my end. Oh, and now reestablished. So hopefully you guys are still hearing us. The Bill Snyder, who's not Bill Snyder, you've been unmuted if you would like to talk.
Okay, is that still me?
Yeah.
Yeah, it's
So.
Bill again.
Okay, here's Bill again. I actually, I don't have any questions. I really appreciate you guys offering to be this much of a support, because I know questions will come, and I'm confident Jenny will utilize you all well with questions. Yeah, but I don't have any questions.
I think Jenny's going to do an awesome job in her position, and I have no doubt that she'll ask questions if she needs help. That's great.
Yep, I agree. I didn't
Jenny
mean
is
to have
unmuted.
my hand
Can you
raised.
hear me?
Yes.
I am here.
Jenny, we hear you.
I have like, I have so many questions. I don't know what one to ask. So I'm trying to soak it all in. So thank you.
Absolutely.
I got your back.
Thank you.
Now, that's one of the nice things about this is there is a lot of support, and over and above Darren and Lisa and I, you guys are support to each other. You know, part of that learning collaborative process is to make those connections so that as you see maybe another agency that's doing something well, you can reach out to them and say, hey, I love this form. You know, Darren mentioned we did a fidelity review of Clubhouse recently, and they have an excellent benefits planning face sheet that we asked if we could share with others, and they said yes. It's marvelous in regards to kind of the questions that it asks, and you know, kind of how it frames things to get people thinking of the holistic benefits planning, not just SSI or SSDI, but you know, housing and food and medical and the whole works. And so you know, you'll see that kind of thing with other agencies, and this learning collaborative allows you to make those connections so that you can talk to others. Renee says, yeah, same here. It's a lot of useful and appreciated information that I have information overload. Yeah, I'm sadly sorry. That's part of my brain that asks questions is shut down. Can't wait to move forward with this for our clients. There is a lot of information, and there's time. You know, you start where you start. I love the Maya Angelou quote about we do the best we can, and when we know better, we do better. And I'm not quoting it just exactly, but just that concept makes a lot of sense to me. You start where you are and you improve from there.
But just remember, you're going to look at the vocational profile. You're going to look at the vocational profile, the job search plan, the follow-up plan, and the disclosure form. If you just start with those 4 forms as a part of building your file out for your services you're going to be provided, you're going to be in good standing.
Shall we take the break now, folks?
Yep, we can take a break. We can take a break now.
Harrison said, can you repeat that, please? So, Lisa, what you just said. The
okay.
Vocational profile.
Yeah, so there's I call it a vocation profile. I'm sorry, I don't know, I can't get that on my system. But when you look at your resources, you're going to pull out the career profile, the job search plan, the follow-up plan, and the disclosure form. That's what we would look for in your files as far as fidelity goes. Also, not just because that's what we would look for, but because these are the tools that are going to help support the individual job seekers. Career profiles to gather all the needed information about their employment goals, living document, add to it as need be, job search plans, breaking down those small goals that you and the job seeker are responsible for, follow-up plans, planning for what your support is going to look like, and then what you're going to disclose and what you're not going to disclose. So if you can pull up those 4 forms and start individualizing them and or deciding that's exactly what we're going to use, then we did good today.
All right, so it's about 10:20. Let's go for break until about 10:35. If you come back at that point in time, then I'll start with my piece. Thank you.
Great, thanks, Dawn. Thanks, Lisa. This is Darren. I just wanted to reach out, and I'm kind of curious where people are on the onboarding of employment service staff. I know I've talked to some providers, and I think we have some new staff probably in this meeting right now. So if you could just kind of give us an update in the chat log to see where people are at, if they've made some hires or they're still in the interview process, interviewing candidates. I'm just kind of curious where folks are at one of the contract deliverables that we're looking for in September. Thank you.
Darren or Lisa or one or the other of you still there? So I hear we have folks out there somewhere, it would appear. Can you see my screen? Hopefully,
Dawn, can you hear me?
roles. Yes.
Oh, good, because I had
can.
to call back in. Yeah, it hung up on me. But anyway, so I'm back in, and yes, I can see your screen.
Oh, thank goodness. Thank goodness you're back in. I was joking yesterday when I said I was going to be thankful when the presentation was over, knowing that we and everybody else has had some technological difficulties here recently. And thank you, Christine. I see a yes. And I see a couple of questions too, or a couple of comments I'll wait to read until we actually start again. But I was joking yesterday when I said I was thankful when this was going to be over today. I probably jinxed us.
Okay.
It was my fault. It was me. I'm sorry. You know, I had heard, and because we don't have access to Zoom, I don't know the full scope of it, but I had heard that sometime here in the past week, the whole Zoom platform crashed. And so we aren't the only ones that experience technical difficulties. I know that kind of every webinar I've been in recently has had some little blip here and there. So it's just, I think, part of surviving the work from home pandemic stuff. And I think people are pretty understanding about it.
Well, I'll never forget now that the VPN was blocking me the whole time. I mean,
yeah.
So I no longer will. I'll make sure my VPN's not on.
Yeah. I had somebody, I think it was Wanda, tell me that was the case, and I've had to do that on occasion. So, yeah, it's tips and tricks to remain as well.
Today.
Yeah.
So Darren asked a question, about who all has either received a contract or is in the hiring process. Is that what you said, Darren?
Yeah, he did, and there's a couple of agencies that responded. I don't know if we want to wait until after folks get back to share their responses, or if we want to just discuss it now. Northwest Health, and I can't remember what the I stands for.
Integrated.
I apologize. But Integrated, thank you. So, Brandy says, I believe, has hired one candidate as well as conducting interviews currently.
Yay.
And very much yay. And Renee had said HR had a COVID scare that slowed things down for us. The job will be posted later this week. So hopefully we can interview and hire in 3 weeks max as we have a good candidate for the position. So that was Renee. And those are the only 2 responses we have so far. But we can ask again.
Somebody said, can you repeat, please? Maybe we can ask the question again, because it is good to know where each agency are, but we could probably maybe individualize some communication afterwards, so we can kind of get a gauge where people are. So at this point,
yeah, we can.
Well, and we could put it in the thank you for attending email if we want to. The 2 questions.
Yeah.
How are you doing with becoming an FCS provider, and have you been able to hire yet? Because those are our 2 deliverables. So it would be nice to know kind of where people are at and if we can support them in some way.
Good idea, Dawn.
Agree.
Yeah, well, we can. I can draft the thanks for attending email and send it out to you guys to tweak it. Let's see here. I've made notes about all the things Lisa.
I trust you.
Talking. Pardon me.
I trust that you'll do a fine job.
Oh, thank you. Let's see. I'm making notes. I'm trying to talk and make notes at the same time in regards to stuff to include.
Yeah. And I'll just make sure to have the 3 links. Yeah.
I was thinking perhaps sending the SE resource sheet because it has those links as well as the information about our webinars and getting on the distribution list. So it has kind of all of it in one form. And it has Darren's and mine contact information. So I was thinking about sending that an attachment. So what I'm going to do, since I think Christine confirmed that she can see my screen. I'm going to have you guys watch the chat box, the questions and things. And if you need some, well, can you guys see my screen too? Can you see here where I'm?
There's role responsibilities.
Okay, so see where it says unmute all participants? That does that, but then you'll see here where there are the red microphones. That means if we unmute all and they're still red, they've muted from their end. If they raise their hand, it shows up here. If they have questions, it actually shows up in the chat box, in the question box. And the chats do too. They all pull over here. So if you're needing to look up any of those kinds of things, you know, here's muting and unmuting. You can unmute individually and remute individually. You can see number of hands raised here, and the questions relates back to this. If you click on this, it pulls out this box, and if you do that, it docks it again. So
is everybody muted right now?
Everybody is not muted. They're hearing what's going on, so they just got a brief tutorial on GoToWebinar.
Yay! you're the
with that.
Everybody needs to know this information.
It doesn't hurt. Seems like we all end up in this scenario at some point in time. Can you see my slide plus the next slide coming up, or can you just see the slide that's current?
I see
the slide
both,
in the
primary.
Okay, you know what? I'll leave it that way. I think that's all right. No, I have no notes on any of them. Then previews of coming attractions is just fine. The one thing that I'm going to do, I think I am or am not. I'm in the VPN currently, and so far it's been going well. I hope I'm not jinxing myself by saying that. Oh, there we go. I was able to escape. I want to see.
One of the things I was going to say is delete the current questions so we know when there's new ones.
Say that again. Sorry.
I'm trying to remember questions so we'll know when there's new ones.
What I've just been doing is, okay. Well, I may have goofed myself up now. What I've been doing, Lisa, do you see where it says questions here in 34? I'm just watching to see if the number goes up. And if the number goes up, you know there's a new one.
Okay, we can do that too.
Yeah.
To interrupt you, Don, when the question comes up.
Aaron, I think I lost you. Maybe I lost me. I hope not.
No, I can hear you.
Do you want to interrupt as the question?
Sure. Feel free.
All right. Thank you.
And there's actually a couple of slides where I'm going to ask for other suggestions. There are a couple of slides where in my slide I'm going to ask them, like, what makes a good supervisor? You know, what ideas do you have? You know, what kinds of things are you looking for? We didn't ask. We asked if they've hired employment specialists. We didn't ask if they've got a supervisor yet. So that would be good to know too. I suspect most or all do. But as was mentioned, COVID is put a monkey wrench in the works, and so maybe not in all cases do they have a supervisor hired as yet, so, or identified. Hopefully so.
Absolutely.
Yeah. How are we doing time-wise? 10:34. Okay. At least to answer your question from earlier, there is a way to deal with already answered questions and get rid of them, but I would have to search to find it, and we'll do a practice session and do that.
Yeah,
I do see that.
I think that would be helpful because I can't also see like the full, all the questions, like I clicking on everything, trying to get the big picture of it, you know?
Right.
Oh,
yeah,
now I got it.
I don't think it doesn't get big enough to see absolutely all of them. You got to scroll because there's a bunch. Looks like Angie has said PBH has hired an employment specialist, Harrison, and I am the supervisor. Congratulations, Harrison and Angie. That's marvelous. And then we saw that, and I'm assuming most folks are back. I'm reading from the question box. You're welcome, Harrison. Northwest Integrated Health, Brandy had said, I believe, has hired one candidate as well as conducting interviews currently. And then Renee had said HR has had a COVID scare, and that slowed things down for us. And I suspect you're not the only ones. The job will be posted later this week, so hopefully we can interview and hire in 3 weeks max as we have a good candidate for the position. So great information, and thanks for answering that. We're still looking for input from agencies in regards to whether they've been able to hire, but we're also going to include that question in our thanks for attending email so that you can send it back that way if you need to perhaps get an update on where things are at. So I'm going to go ahead and start with my section. Thanks for returning from break. Go ahead and folks that aren't talking, go ahead and mute if you would, please. All right. So I've said all the way along, my personal opinion is, and I suspect it aligns with a lot of yours, the importance of a good supervisor is huge. The role of the supervisor is woven throughout IPS principles. There's, one principle that is specific to the role of the supervisor, but there are other principles that are impacted by the supervisor. A good supervisor can help an IPS program or any program to excel. And a question that I would ask you to just kind of consider as we go is, does the supervisor have time to supervise, or are they spread too thin? I ask that only because in fidelity reviews, I've seen kind of time and again where the supervisor has so many responsibilities that potentially they can't do the training of the employment specialist or perhaps other staff. And then what makes a person a good supervisor, in my mind, job knowledge, obviously leadership qualities, obviously. What other qualities? If folks want to put in the chat box in regards to other qualities that they see that are making a good supervisor, I would welcome seeing those. In the meantime, though, I'm going to move on to the next slide. What I've done, and you'll see some of the slides like this one have a lot of verbiage. This came directly from the Fidelity Scale. So there are 5 key roles of the employment supervisor, and I've just quoted from the Fidelity Scale with the thought in mind that when you get the PowerPoint, that information will be available to you. I am not going to read from the slides, except for a little bit here and there. So you can see that it talks about a full-time equivalent supervisor and how many people they can supervise. And then also with the caveat, if they're supervising other people, you've got to watch the percentage of the time that's available to the supported employment program. That makes a huge difference related to training and some of the things that I'm going to discuss later in regards to field mentoring and things along that line, especially with the new staff. So one of the things that a supervisor does And I will tell you that I'm speaking from personal experience. I was an IPS supervisor in a behavioral health agency. Actually, the IPS part we did for about 5 years, but supported employment for over 20. The supported employment program existed prior to my getting to the agency. And as you can imagine, and as happens, I had other responsibilities. I had other things that I had to do. And so I had to be able to monitor in such a way as to be most efficient with my time. And you can see from this, the kinds of things you're going to want to monitor: number and type of job placements, number of employer contacts per week, length of time between program entry date and date of first employer contact. That's one of the IPS principles that's incredibly important. Darren had mentioned it, and when people say they're ready to work, they're ready to work. I provided supported employment in kind of the old style in years past. Darren had a slide that related to that too, and I can say that we used to have people go to interviewing classes and how to do a resume classes and how to do an application class. And maybe they went through a couple of different assessments, and, maybe it was weeks into things before they actually ever got to talk to an employer. And I have to say, we lost a lot of people that way. IPS recognizes the fact that if a person says they're ready to work, they're ready to work. That doesn't mean they want to go through a bunch of classes and things. And so this length of time between program entry and date of first employer contact is important. Within 30 days, either the person or the employment specialist or both contacts an employer, as Darren mentioned. And that's for high fidelity. And certainly sometimes it goes longer, sometimes it goes quite short in regards to getting in front of the first employer. But that's one of the things that the supervisor is definitely going to want to track. Percentage of time in the community relates back to the fidelity item that talks about for highest fidelity, 65% of the time in the community. But when you think about it, so much of IPS just is common sense. It only makes sense that the way you're going to get jobs is being out in the community to do it. And obviously not now with COVID-19, but I have every faith that at some point in time we'll be able to be back out in the community and doing some of the things that we were doing before, perhaps still with the social distancing and masks and things, but it'll happen, just a matter of when. A supervisor is going to want to monitor documentation, both in relationship to quality and quantity. So Lisa gave some great tools, some of the forms that not only are going to help you from the standpoint of providing a good service, but also going to help you from the standpoint of the supervisor being able to, in an efficient manner, look things up and see how things are going. So how will they document client services? The career profile, the job search plan, the job support or follow along plan, the disclosure form. Those are some great tools, both for providing a good service and for tracking it. How will they track employer contacts? I'm going to show a little later on an example of a participant log. It exists on the Pathways to Employment website, so it would be one thing that you could download. And not only is it helpful for the supervisor to be able to track a variety of things, it is actually helpful for the employment specialists themselves to be able to keep track of where things are at. How many contacts did I make? How long ago was it that I went and talked to Safeway and I promised them I'd come back in a month? When did the person start their job? Things along that line are all on that participant log. A supervisor is going to want to track individualized follow along, what the person needs and how often. It'll be something that you'll discuss in the vocational unit meeting, and I'm going to be talking about that too. And, I bolded it, and I'll say it again, and I bolded again. Tracking forms are a must for efficiency and time management for a supervisor. The alternative, very honestly, is reading each and every progress note. I'm gonna go out on a limb and say I can guarantee you don't have time to do that. So tracking forms are a must. Supervision tools and considerations. This is kind of a preview of a coming attraction slide. These are things I'm going to be talking about in greater detail as we go. Supervisors and what you're doing at this point in time should attend similar trainings and or have knowledge about the jobs for those they supervise. I know that job development is kind of an unusual skill. And I also know that it's one that when we've done fidelity reviews, some supervisors haven't learned. And so it's hard to provide that training to employment specialists, and particularly if you have someone who quits a job and you have to hire and train somebody new, it's important to have those skills. So I'm probably preaching to the choir on that one, but I do know that it's something that we've seen when we've done fidelity reviews, that not all supervisors are trained in that skill. So use of tracking tools, participant log, job development log, maximize your time as a supervisor, and then maximize your time as an employment specialist. And Darren had already mentioned that if it wasn't documented, it didn't happen. One of the things that we hope to see when we do a fidelity review is documentation of individual supervision, if you do individual, and of unit meetings. So if you do group supervision with the employment specialists, we would like to see documentation of that. We would like to see what was discussed. And frankly, once again, it's a nice thing for you to be able to go back and look at and say, oh, we talked about that in this month, and maybe I have notes for that and I can find them because of that. Field mentoring logs or some other kind of log developed by the agency for documenting. Lisa already mentioned that the forms that IPS has available or that are on the Pathways to Employment, which a lot of them are IPS forms, you can pull them and look at them and then, create your own to some degree. Make sure it keeps the intent of the form. And it's also nice if it keeps the same kind of title as what the form had previously. But you can develop your own as needed. I'm going to show you a couple of different field mentoring logs. IPS recommends that a supervisor does field mentoring with employment specialists on job development. And there's a form for that, big surprise. That's what the field mentoring log is. And then just in general, there's a field mentoring log for maybe teaching an employment specialist how to do a career profile, or how do you do some open-ended questioning with the person on your caseload, some motivational interviewing kinds of techniques, or just more general kinds of things that you might teach an employment specialist. So there's a log for that as well. Once again, you don't have to use that one. If you have different documentation that covers the same information, that's great. But I will show you those a little later too. There is, for a variety of reasons, there's a need to be able to easily pull data related to number of job placements. Foundational Community Supports has been, it's a transformation project. And it's been utilizing the 1115 Medicaid waiver. The waiver was a 5-year waiver with the possibility for extension. But it's not going to be extended forevermore. So part of the way that this service is going to be sustained is if we're submitting good data. I know somebody mentioned, in one of the comments in the chat box, thank you for all this assistance. I have selfish reasons for giving you assistance. I'm going to be very honest about that. I want this program to continue. And in order for it to continue, agencies have to be doing their best. And they have to be submitting good data. Within fidelity, there's high fidelity, there's exemplary, fidelity, down to not supporting employment. A lot of agencies hit that good range, and good is good. We hope that agencies hit that good range. That means that you're providing good data because you're having good outcomes, and that's part of what's going to help to sustain that funding overall. So identify or develop a system for tracking staff time in the community. That one's been, Darren mentioned, that's been really hard for agencies to do when we do fidelity reviews. What we're looking for is duration of time and where did it happen. I know when I worked for the agency that I worked for, we had an electronic health record, which had a scheduling component. It was Anasazi, which was turned to Cerner, and then the agency opted to purchase Credible electronic health record system. And in each case, they had a calendar kind of a function where the staff could track where they were and for how long. And that's the kind of thing that we're looking for. But even if you're looking at an Outlook calendar or just a calendar in a paper calendar, you know, if you have a day minder or whatever, having staff from the beginning write down length of time, whatever appointment or activity is, and where it's located. Is it in the office? Is it out in the community? Is going to be a really helpful thing. So setting up those tracking systems early on is going to help staff to be able to do that kind of thing. So number 2 in supervisor role and responsibility that shows up in the Fidelity Scale, supervisor conducts weekly supported employment supervision. It can be individual, it can be group, it can be whatever works for you. When you do, and if you look in the Fidelity Scale, it talks about vocational unit and vocational unit meetings. You can develop a standing agenda. What IPS is hoping to hear, and for good reason, is when we go to observe what you're doing related to IPS principles, we're hoping to see that the vocational unit talks about individuals and what kinds of jobs are they looking for, what kinds of problems are they having, what kind of follow-up needs do they have, so that you can brainstorm together and come up with some ideas. One of the technological difficulties that we had was we wanted to be able to show you a video that's actually on YouTube. If you look on YouTube and you look up IPS, there are, and I can send out more information. Perhaps I can send out a couple of the links to a couple of different videos so you can watch them on your own. But there's a great example of a unit meeting. And in this unit meeting video, the supported employment staff is there. The DVR counselor is there. And they're brainstorming about a person that's having difficulties in not showing up and discussing, you know, how to help them re-engage because they're getting ready to start a job, and how to talk to the person and maybe identify what challenges they're having and that kind of thing. So that's one of the things that you'd want on your standing agenda for the unit meeting would be individual staffings, job searches, and you know, maybe if we're talking Darren and I and we're the vocational unit and I've gone out and talked to an employer and I don't have anybody on my caseload that fits, but I'm pretty sure Darren does, sharing that kind of job lead in the meeting is another thing that you want to do. We would like to be seen, I say we, employment agencies would like to be seen as kind of the go-to for employers to be able to help them find good employees. And so sometimes it's a matter of checking with the other employment specialists and seeing if there's somebody on their caseload that fits the opening that you know about and is interested, obviously, in that kind of job. It's always about client choice. If the person wants to do the job and you know, there's an opening that one of the other employment specialists is aware of, we'd want to share that. And then one of the other things that is noted as far as being important within the vocational unit is that if you have more than one employment specialist, and I know some agencies do, some don't, you know, that's you are where you are, but for highest fidelity, you would want at least 2 employment specialists. And part of the reason is so that they can cover for each other when there are coverage needs. And that doesn't just mean a vacation or sick time. It also means things like maybe I'm doing job coaching with somebody and I have somebody else that has a job interview at the same time that needs someone to go along with them. Those kinds of coverage needs are important too in regards to being able to kind of fill in for each other. It's important to consider how are you going to document the meetings. A lot of agencies have a team meeting form or format or agenda. In some cases, it has standing agenda items. I know the agency that I worked for had a team meeting agenda, and a lot of the standing items weren't relevant to IPS. And so in a lot of cases, I simply said NA because I wanted to be able to get back to the things that were related to supported employment, including the staffing of individuals and problem solving and sharing job leads and things. And then a supervisor, or perhaps someone from the leadership team, may want to meet with the VR supervisor, or if you have a VR liaison, to request attendance of unit meetings monthly and I say either at the SE office or DVR or alternate, we found great success in doing our unit meeting once a month at the WorkSource building where DVR was located. And very honestly, that put us in a setting where we were able to talk to the other WorkSource staff. The agency that I worked for was a WorkSource partner, so it was pretty easy to do. We even had dedicated space there to be able to access if we needed it. It's something to consider. A lot of these things are considerations. You're going to do what works for your agency, but I'm giving you some ideas in regards to what to think about. So the third item in the supervisor roles and responsibilities is supervisor communicating with mental health treatment teams and being a champion. And that's what my little picture here is about. Is that's a champion. That's a person that believes strongly in supported employment and is going to speak to others about it in kind of that light. That champion or that supervisor attends meetings for mental health treatment teams on a quarterly basis, but not everyone is a mental health agency or behavioral health agency. A lot of agencies do have multiple teams within their agency, however, and so this could be relevant too, to if you have separate teams within an agency and they have team meetings, attending those on a periodic basis in order to share the information about supported employment and determine what else you may have. We need more referrals, or we want to do some training with you related to zero exclusion, or whatever that might be. Oops, I think it popped one ahead. There we go.
Hey, John, before we get too far, there is one question about when ends the 5-year waiver ending.
Okay, so the last I knew, and I'm not fully up to speed, and Lisa, maybe you are more so than I am, the end date was intended to be December of 2021, but they're asking for an exception. And I haven't heard yet whether the exception was granted, or not an exception, excuse me, extension. Do you know, Lisa, whether it has been?
No, I haven't heard a final word on that. All I have heard, and I've heard it a number of times, is they feel very confident that they're going to, that these services aren't going anywhere. I mean, the outcomes, our initial outcomes that we've got so far have demonstrated some great successes, and we at least at minimum would have a year extension. And if people are doing the math, it actually looks like it's been 4 years, because we received approval July of 2018. We started services in January of 2018, but July of 2000, it must be 17, am I right here? We got the approval from CMS saying we were approved. The clock started at that time, but we didn't actually get the final approval and weren't able to start till January of 2018. So we pretty much lost a year. So we are confident we're going to get that 1 year back. And then of course the goal is it becomes a permanent Medicaid benefit.
And I'm hearing, based on and thank you for that, Lisa, you're absolutely right. I'm hearing the same things you are in regards to our leadership, seeing that the data shows that we're doing the things that we said we were going to do. There are good outcomes, and we do have reports, and are soon going to have a second report related to what's been going on and the outcomes in general. That are very, very promising for both supported employment, and I will say for supportive housing too. And so that's the kind of thing we're looking to provide, is that positive information with facts that support that it's working, and it is. So a very good thing. Thank you. So I talked about the supervisor being a champion and advocating within the agency. This slide talks about training. Training is advocacy, very honestly. With a brand new program, especially when perhaps the employment staff is familiar with it, but no one else is, that training performs the function of being an advocate. So The supervisor may or may not, based on what your leadership decides, do training with all staff, including supported employment staff, because all staff will play some part in IPS. It isn't just a one small team kind of a thing. It's an overall overarching agency kind of thing. And so staff will periodically offer information about IPS to people on their caseloads and ask if they're interested in being referred. I think Darren probably talked about that in relationship to IPS principles. I've heard staff from agencies say that they bring it up when somebody says they're bored. They bring it up when somebody says they're tired of being isolated, or they feel worthless, or they lack income, or it isn't necessarily just a person saying, I want to work. Sometimes it's those other things. And so all staff is involved in that. It's a collaboration between teams to promote continuity of services. So let's say somebody in the agency referred to the supported employment program, but they're continuing to work with a person. You'd want to continue collaborating to make sure that you're all on the same page and that the right person is providing the right service. I say that because one of the principles relates to, and Darren mentioned, IPS staff doing only supported employment services. If somebody needs to go to the food bank, it's possible the supported employment specialist would do that if it relates directly to back to the job. And very honestly, if I was the employment specialist and the person had no lunch at work and was low energy because of it, I would relate that back to supported employment and perhaps take them one time to the food bank. Then I'd make sure they were referred to somebody else that could do that in the long run. So it is also about making sure that the right person and the right team does the right service. All staff play the part in providing support to individuals receiving services like the food bank. All staff practice zero exclusion. It isn't just an employment staff kind of thing. You know, I mentioned that I worked for an agency that did supported employment for over 20 years. I'm still doing, actually, so they're getting closer to 30, I think. One of the things that we found when we started IPS was we were not close to zero exclusion. There were staff that felt like people had to be free of symptoms, felt like they had to be, you know, fully trained or whatever in order to start a job. And I've said, and it's sort of joking and also very serious, if I had to wait to be free of symptoms, I maybe never would be working. And I'm sure some of you can relate to that. It doesn't make sense that a person has to be symptom-free to go to work. I've had friends or family members over a period of years that used substances and still were very reliable workers. So being free of substances isn't a mandate. It is important to know the employer that you're applying for, and if they do drug testing and expect that a person be free of substances, that perhaps that's not the right job for them, and talking with the person about, you have a choice to make. If you want to go forward with this particular employer, then, you know, be aware that you may need to quit using substances, or you may choose a different employer. So that practicing zero exclusion is everybody's role. And then being supportive of competitive employment. If you look at the Fidelity Scale when it talks about competitive employment, it mentions that transitional jobs or volunteer jobs or those kinds of things are not the focus. And I think as an agency that used to do the old style supported employment, we thought we had to do assessments and see where people were at. And we do. We have to do the career profile. It is an assessment. But very honestly, getting a job is the assessment. You know, when a person gets a job and succeeds, that's grand. And if it's the job that's perfect for them, all the better. But I don't think any one of us is in the first job that we tried out. All of us has kind of done an assessment of ourselves in jobs by trying on jobs and seeing how they worked. It's the same thing for the people that we serve. And so all staff will play some part in being supportive of competitive employment. And not because it's a mandate, but because it makes sense. Like I said, there's a lot of IPS that's just common sense, and that's one of the things. None of us is in the first job that we got, I suspect. And then as far as supervisor advocating within the agency, they may be providing that initial training to other supervisors and perhaps staff outside of the SE team and even outside of the agency. I know as a team, our little trainer team has done a lot of training with DVR and discussions with DVR because our principles differ to some degree. And so we've talked about what's the crosswalk. And I know IPS has got a crosswalk between, DVR and IPS services and how they might coordinate together. But there are other agencies that we work with, and so there are potentially other times when we would discuss with different agencies about how do we collaborate, how do we coordinate, and the supervisor is a key candidate in doing that. Interaction with leadership within the Fidelity Scale. There's mention of the fact that the supervisor is supposed to at least twice yearly share information about potential challenges in IPS, and it should be documented. Second bullet item where I said documented sharing of ongoing issues regarding potential challenges with leadership. Should discuss agency goals for IPS and get that feedback from leadership, and that should be something that the supervisor is involved in. Celebrate successes with leaders and managers and agency staff. One of the ways that the agency that I worked for moved away from zero exclusion was through those shared success stories. When, let's say we had a therapy team, and when the therapists heard, Jane Doe just got a job, and they knew Jane and they knew the challenge she had, and knew others on their caseload that had similar challenges to Jane, they were far more likely to refer and feel comfortable that success was imminent. And so that was the sharing of success stories was a really important way that we diminished at least zero exclusion. And then asking leaders how they'd like to be updated about ongoing training and consultations and things like that would be another key role that the supervisor holds in relationship to interaction with leadership. Collaboration with DVR and other stakeholders. Right now, we know that DVR is an order of selection. I think from what both Darryl and I are hearing, and probably Lisa from doing fidelity reviews and things, is that what that's kind of caused is a scenario in which agencies simply aren't communicating with DVR. Hopefully, order of selection won't last forever. It happened previously, I don't know, 15 years ago or something like that, and it went away. I don't know whether it's going to go away at this point in time. But there are individuals that we serve that would benefit from some of the services offered by DVR. So it's still very important to maintain contact with them and to have that relationship in place so that as people need those services, that they can be referred to DVR. So the supervisor or leadership should be talking with the DVR office, with either the supervisor or the liaison about, will they come to vocational meetings? How often? Will they ever attend other team meetings in the agency? Are they available to do some training related to DVR services to the agency? How will referrals be managed? Discussing benefits planning. DVR, if an agency does not have benefits planning available, DVR does for the individuals that have applied for services. And my understanding is even before they receive services, they can get benefits planning. That shouldn't be the reason to refer to DVR. We're not going to inundate them that way, but if they're going to receive DVR services at any rate, they will get a benefits plan. And then in relationship to the supervisor and collaborating with DVR and other agencies, some of the other ideas as far as agencies they may collaborate with would be WorkSource, Workforce or the TANF program, Department of Corrections, Aging and Long-Term Support Administration. I know that a percentage of the people that receive FCS services are referrals through ALTSA. And then others for the needs of the individual. I've seen lots of different options. Darren mentioned NAMI. Darren mentioned NA. Darren mentioned some of the things like that. And part of the idea of IPS and involving treatment teams is that we're going to build a support team around the person. And anybody who is important in the person's life, whether it's a natural support or a paid support, needs to be part of the support team if the person agrees. They obviously have to sign a release to be able to allow people to attend, but the more that people are supportive of the individual, the more likely they are to succeed in the long run. Have you all considered about how you're going to market the program within your agency and maybe within the community? How are people going to get referred? How will they access the IPS services in the agency? Within the whole AmeriGroup process, agencies can decide whether they want external referrals or internal referrals or some combination of the two. Internal obviously meaning people that you're already serving and then helping them to get access to the FCS services if they qualify. But at some point in time, you may want to consider external referrals as well. I know, when we talk about DVR, they have been an excellent source of referrals to the FCS program. For those people that are on the waiting list for order of selection, but they still need the assistance and maybe don't qualify as yet for DVR services, a lot of DVR counselors have been wonderful in referring them to FCS supported employment so that they can still receive services and move forward. Marketing the program, you may want to schedule to attend other team meetings within the agencies to provide information about the program and how to refer. And I already have kind of said, how can other stakeholders be part of this? DVR, in Moses Lake, where I'm from, the Work First program used to refer to our IPS program pretty regularly, and we were part of the local planning area team here because they did refer pretty often. They are individuals on Medicaid, and data shows that I think it's a third of people on Work First have a diagnosed or undiagnosed mental health issue. Personally, if you're a parent and you're trying to help your kids and you to survive and you're not working and all those other challenges going on, I think that's a really low percentage. I think it's probably more than that. And so the Work First program is one where you're likely to get some referrals. So how do you market the program? Sharing of success stories internally and externally, and I already mentioned that. Perhaps via newsletter, perhaps via word of mouth. Did a fidelity review of one agency here recently that had a bell that they rang every time that somebody got a job. And the whole agency could hear that. Did a fidelity review of another agency that did an email to all staff when somebody got a job. And they all celebrated those successes. So sharing of success stories is a really important way to market the program, but it's also an important way to acknowledge people and the successes that they've achieved. I think we work with a group of folks that may not have had a lot of success in their life. If they have had, they may not have had it acknowledged by anybody. And so for their benefit, we need to acknowledge those successes as well. So other ways to market the program: periodically attend team meetings in each department. So maybe quarterly you go to a team meeting in each department and discuss how it's going and how the referrals are going and whether they're needed. There are various agencies that have newsletters that they either share internally or externally or sometimes both. There's an agency in Spokane that has 3 of the most compelling billboards I have ever seen in my life in relationship to the fact that people deserve the opportunity to work, and that if they need assistance, that they can contact that agency. Just amazing, compelling billboards. So they've decided to kind of take it to the next level. Determine which external stakeholders may refer when you're ready for that, and meet with them and discuss might be another way to market services. So number 4 on supervisor roles and responsibilities. Supervisor accompanies employment specialists who are new or having difficulty in job development in the field monthly to improve skills. That's where I mentioned that we have the mentoring forms. Let's see if I can get to them. Let's see if it's going to behave. All right, I hope everybody can see that. What I have got is the field mentoring checklist for job development. This is one that's on the ipsworks.org website, and you can see that it's very much related to employment specialist, supervisor, and kind of the different things that you're going to talk about, what you're going to do on the way out, or what happened the last time. Here's the skills you're going to focus on, successes, employers, and actions for follow-up. So it really is a mentoring form that then both the employment specialist and the supervisor sign off. I mentioned the other field mentoring was just in general. So sitting in on the session with an individual and teaching them. What I used to do as a supervisor is I would have them sit in on one of my sessions, or 2 or 3. Files and that kind of thing. It looks like I may have been bumped out of audio. There we go.
No, we can hear you, Dawn.
Thank you.
I can see your form too. You're doing awesome.
Oh, thank you, thank you. So I would have them sit in while I was doing sessions with people in order to teach them, and then I would do the reverse. I would sit in on their sessions and provide additional information. And here's a form in order to, kind of indicate what you're doing, and then some information about that. It is absolutely okay to provide these things within another supervision document. It doesn't have to be the specific document. Wanted to show you too, this is one that's just in my mind so incredibly important. This form was developed by Melody Paisolt back when we did the BEST grant sites, the 2 BEST grant sites. She took each of these categories directly from Fidelity. If you use this form or something very similar to it, you will be able to show the documentation you need for Fidelity. But even better than that, as a supervisor, I would take this form and I would look, and I would be able to see, okay, here's the name of the person. I know they're on Dawn's caseload. They did first contact, and then here's their job development start date. It was within 30 days. Wonderful. I see they did it calls it vocational profile, but where I think IPS is calling it a career profile these days. It had information about date, place in employment, employer name, job title, rate of pay. All of those things are important for knowing whether it's a competitive job. Date of employment change or reason. And part of zero exclusion, and part of just what we know common sense wise, is that the person may or may not stick in that first job. So it has an opportunity to document second employment placement. On this, you see the tabs down below here. On the second tab, I think the biggest difference is that there's second, third, and then some additional information at the end of it. But to be able to keep track of how many jobs a person's gotten and why they've left. When a person leaves a job, we would hope that the career profile would be updated with lessons learned, so that maybe the next job match fits a little better. And then this was one of the other things that I found hugely important and helpful, was it allowed in the same place, in the same document, to keep track of what the job development contacts were. So business, title, address, city, all those kinds of the basic contact information stuff. IPS says it's supposed to be a hiring authority, so here we get to say yes, no. What kind of contact was it? Face-to-face, phone call, what was it? When we're when we're back to what is our new normal, I know people hate hearing that, but I think if there's going to be a new normal, then we would expect to see that for employer contacts to count, they're going to be face-to-face. And what was the outcome? Did you promise to come back? And in any employer contact, one of my last questions is, may I come and visit with you again? Within your timeline, what's a good timeline? Is a month okay? Can I come back at that point in time? To start building that relationship. And then if you said you're going to come back in a month, come back in a month. That's how you build trust. Individual in mind for the business, so you can kind of keep track of of, you know, if there are 20 people on the employment specialist caseload, is everybody on here? Are all those 20 on here? And then who's the employment specialist? Because I got a date and I got an employment specialist, I can say 1, 2, 3, 4, 5, 6, look at that. They got their 6 employer contacts for that week. So as a supervisor of employment specialists, I don't have to read every progress note, thank goodness. So I cannot say you have to use this form. I'm going to strongly encourage that you consider using it or something like it, because it's a help for supervisors, it's a help for the employment specialists, and it's also a help for fidelity reviewers if we come and review your agency. Lots of good reasons to use it. And as I mentioned earlier, this is on the Pathways to Employment website. So when you go looking for it, that's where you'll find it. How are we doing? Have we got, looks like we might have questions.
Should have
Scrolling.
download the.
There we go. Okay, where can we download the form? Yep, Pathways to Employment website. All right. Trying to get the slideshow going again here. And there we go. Now we got it. Okay. So we talked about the general field mentoring log. We saw the job development field mentoring log as well. When you're mentoring and training, hopefully some of that mentoring and training happens with other staff within the agency, and finding out about how often are people being asked about supported employment services. Is it when they're saying they're bored or they need work or they need, you know, whatever they might need? Zero exclusion principle. I can almost guarantee that every agency will have one person at least that is unsure about that and has questions about that. So there is mentoring to be done there. Cross-training of other departments and other agencies. When I was on the IPSworks.org website last night, one of the things that was recommended of a new employment specialist was that they get to shadow staff from the other departments so that they're fully aware of what's going on kind of throughout the agency. And that they can talk to them about their new position and what they're going to be doing. And then motivational interviewing is a great tool to be used by employment specialists. Training agency and other departments, or training agency staff and other departments, I think we've talked quite a bit about that. So the 5th supervisor role and responsibility item on the Fidelity Scale is reviewing client outcomes and setting goals. Part of what is intended to be addressed in the vocational unit meeting is data. You know, where are we at this point in time? How are we doing? Where are areas that we can improve? And so you'll talk about employment rate. You know, how many jobs were gotten in the prior month or prior quarter or 6 months or whatever you opt to address. And, you know, as a group, and then potentially an individual supervision, you're going to discuss that individual number. How many jobs did you help, employment specialist, did you help a person get over this last month? And what kinds of skills do you need in order to increase that number? So examples of goals for the team may be things like increasing numbers of job placements per some time period, increasing amount of time in the community. That pretty much every fidelity review I've done, that's a challenge. I don't think I've done a fidelity review yet where the team actually met that 65% goal of time out in the community. And so it is something that requires brainstorming and training and discussion and offering ideas and suggestions in regards to other things that you can do that'll get you out in the community. the whole idea of having the vocational unit at a unit meeting at a work source, and because you're there, being able to network with staff there is increasing amount of time out in the community, even in and of itself. Increasing number of employer contacts per week is definitely a goal that that I used to set for employment specialists within the team that I supervised. All but one. When we did hiring, and we'd done it over a period of years, and we'd had some successes and failures related to staff that were a good fit and were not. Our best fit for a job developer was a gentleman who had worked for the local newspaper selling ads. And he had less information about social service and more about networking and that kind of thing. I used to have to rein him in a little bit to get him to do some of the other things because he loved going out and talking to employers. But I found as kind of a whole, most of the staff felt a little less comfortable about that. And so it was typically something where we would talk about increasing the number of employer contacts per week.
Hey,
Hey,
Don.
Don, we do have somebody that has a question. Lisa Apple from Okanagan has a question. And the question is, if an individual is discharged from SUD or mental health treatment, are they still able to receive supportive employment services? Just remember, Lisa, that this is a different benefit. So although the individual might have, let's just say, graduated from substance use disorder outpatient treatment, it doesn't mean that the SCS services will have to stop, because your contract or your services, your Medicaid billing, is going through a mirror group specifically for this. So the answer is yes, services, as long as they still qualify for Medicaid, so as long as they still qualify, yes, they can continue services.
Mm-hmm. Very good point. And one of the things that ended up happening with individuals on caseloads of people that I supervised was, as they got a job, perhaps they were going to be booted off of Medicaid. We assisted on more than one occasion a person to get HWD, or Healthcare for Workers with Disabilities, which is the Medicaid buy-in program, which allowed them. We had a gentleman who was very fearful that if he was no longer able to get to go to his SUD groups, that he was going to cease to be successful at his job. But he was in a job, the employer was going to pay for insurance, which would have bumped him off of Medicaid. And so we assisted him to apply for HWD, which he got, and paid that small premium in order to continue to get the Medicaid. And so he was able to continue to go to his SUD groups in order to maintain, in his mind, that was what he needed to maintain his sobriety. And so was very successful. But I will mention the agency that I work for, and I think it's an agency by agency decision as far as what you're going to do. We did have a number of people on caseloads that had graduated from all other services, and supported employment was the last service they were going to get within the agency. We also had, very honestly, and once again, this is an agency decision, we had people referred directly from intake to the agency, the behavioral health agency, that received supported employment only. We had people that came into the intake saying, I've been a truck driver for 20 years, and because of injuries, I can't do that anymore, and now I'm really depressed, and so that's the reason why I'm depressed. And sometimes in those cases, the intake specialist would determine that supported employment was really the thing that they needed. But it was an agency decision to do it that way. So sometimes we had people in supported employment, and that was the only service that they were receiving. Not very often, but sometimes. So really good question. All right. So I've gone over the IPS principle of supervisor roles and responsibilities and some of the things that impact that. I wanted to discuss just some kind of extraneous things that came to mind, that as we provided services in the agency that I work for that were an issue, but also that show up in the Fidelity Scale, that are things to maybe, decide upon before you get to the point of having a staff do the work. One of the things that I know I've seen, and I know when Darren and I work together on fidelity reviews, is there's the fidelity principle that talks about being assigned to no more than 2 teams from which 90% of your referrals are comprised. And part of that, and Darren mentioned, is because we don't want to overwhelm an employment specialist. And part of it's just to make sure that you're getting to the right teams. But sometimes it's hard to determine who those teams are. If you're not a mental health agency, I ask employment specialists and their supervisors and leadership, where do your referrals come from? Are they coming from, I know I had one agency that had a fidelity review, and a lot of their referrals came from an individual at Department of Corrections. And so the hope would be that there was frequent contact with that Department of Corrections staff. I had another agency that was working with a supportive housing program in Spokane, and that's where a lot of their referrals come from. And so the hope was that they were going to be the one with whom that employment specialist spent some time, just in general. So where the principal says that part of the reason you do that is to attend the team meetings, you know, and consider people up and coming that haven't been referred yet, you can still do that with that Department of Corrections example or that supportive housing example. You know, if they've had you sign the appropriate releases of information or oath of confidentiality kinds of things, you can discuss individuals upcoming that might need the assistance that for one reason or another haven't been referred yet. And then assign the employment sales specialist to no more than 2 teams. And that is, you know, as Darren mentioned, to avoid them being overwhelmed and actually to avoid them spending time doing so many things that are not related to the individuals on their caseload as far as going out and talking to employers. Location of offices is a consideration. Interestingly enough, the IPS scale says they need to be in close proximity. If you read the Fidelity Reviewer's Manual, it says in a multi-story building, they should be on the same floor as the teams that refer to them. So it gets fairly specific about where they should be. I can tell you from personal experience, we as an employment team were in the same set of cubicles as were the case managers, and we were right next to the offices that the therapists occupied. And I can't tell you how many times somebody would pop their head around the corner or around the wall of my cubicle and say, "Oh, you're here. I wanted to talk to you about so-and-so." The closer in proximity the employment specialists are to the individuals that are going to be referring, and obviously that's hard if the referral is an out of office, but I'll talk about that in a minute. The closer they are, the more likely those water cooler conversations are going to happen, like Darren mentioned. And they truly do happen. We are also busy, that if you're in close enough proximity and can pop your head around a cubicle wall and see that the person's there, it saves the time of having to make multiple phone calls, multiple emails, waiting for a response, you know, hoping you connect with a person. You know, it allows you that more immediate opportunity to be able to talk to somebody. Now, on the other hand, if the referral source is in a location outside the office, as with DVR, we took our team meeting there once a month. We were a work source partner, and so part of that time out in the community was at work source. And over a period of years, we were able to educate work source staff related to working with people with challenges. We were able to educate about mental health and specific mental health diagnoses or substance use issues. We were able to be there when somebody walked in the door that maybe needed a little extra assistance related to mental health issues or whatever, and to be able to sit in with work source staff to talk to a person or things along that line. So, you know, when I say other considerations, things to think about. Integration of client records. Darren mentioned the principle where one of the subtopics within the principle is the documentation in the same record as the rest of the documentation for the person within their agency services, because it allows for collaboration and cross-training and reducing stigma, very honestly. You know, it just functions in a lot of ways, but it makes it a more holistic approach for serving the person. Something to consider. Easier to do with electronic records, although I think there are firewalls and permissions to be set. That you have to kind of decide in advance how you're going to set them. You know, if this team can have access to this or that. I will say when I was working in a behavioral health agency, we didn't have access to all the nitty-gritty details of crisis contacts or you know, therapy notes kinds of things. But it did overall have access to anything that we needed to look at, and so did the other agents or other teams within the agency. Outcomes to be monitored. What are you going to collect as far as data goes? How are you going to collect it? In what system? And who gets to access it at one time? And you know, or is it going to be per month, per 6 months, per quarterly, per? How often are you going to report it out, and to whom? I know with AmeriGroup, there's their monthly report that you have to report. Actually, pretty brief, and it's you know, fairly easy to do. Report out to them monthly in relationships to a variety of things. There is also, and we're hoping to solicit teams once they've been through a fidelity review to provide that same kind of or similar kind of data to the IPS folks. Part of the way that they get to report how many job placements have been made and that kind of thing, or percentage, is because agencies report data to them. So we're hoping to solicit agencies once they've been through a fidelity review to also provide that data. I can tell you I've reported the data to them. It takes 15 minutes. I mean, it's not a hard thing to do. So we're not talking about extensive stuff, but starting to decide what data you're going to collect, how you're going to collect it, where you're going to report it, is it going to be available to everybody? I know that leaders and folks in charge of writing grants may want to collect the data about how many job placements and that kind of thing for specific grants. So just important to consider. Flexibility of staff. If it's not something that perhaps came to mind, being an employment specialist is not strictly a 9-to-5 job. What happens when somebody gets a job and they need job coaching and it's a graveyard shift? I can tell you for absolute fact that I've done job coaching on graveyard shift and I hated it. And it only happened a time or two over a period of a bunch of years. So it's not like it's going to be something that that happens all the time, but it is a consideration. Being an employment specialist is not strictly a 9-to-5 job. More of the job coaching issues that were kind of strange schedule might have been weekends or early mornings or things like that. The graveyard thing, not as much, but it still was a consideration. And for agencies with more than one vocational unit, will you utilize IPS in all teams? I know there's been agencies that we've done fidelity reviews of that maybe had a pre-existing supported employment program, or they had an employment specialist in an ACT or a PAC team, or on a WISE team, or things along that line, and then they opted to add IPS supported employment. Do you provide the same services to everybody? Does everybody that's getting supported employment, whether it's from WISE or ACT or PACT or IPS, do they all get the same service, or does it differ? You know, what we'd hope to hear is it's all the same service, but it's an agency decision to make. And that's the end of my piece of the presentation. I think what we are open for is questions for any of us. And it looks like there might be, no, it looks like we're caught up for the moment. So if you would please, you right to either be unmuted so you can ask your question verbally. You can type it in the chat box. You can raise your hand. You can do any of those kinds of things. I will say again, we're going to send out the slides and kind of a variety of other things. Sounded like somebody was getting ready to talk and I cut him off. Lisa or Darren, did you have something to say?
Yeah, there's just one more thing. So let's just give it a minute and see if people have some questions. And unmute them and all that, but if we have time, I just want to show one more slide.
Oh, cool. Okay. Do you want to bring that up while people are thinking about the questions they want to ask?
Yeah.
And take over the presentation screen?
Yeah. Okay. If you have any questions, please ask.
Somebody said earlier that there was so much information their brain was in overload. And so keep in mind too, if you have overload brain at this point in time, questions can be asked via email and those things as well. It's probably just easier to ask them here because you have a captive audience. Here I see it looks like there is a, I agree, overload. Yeah. It's a lot, isn't it? I think that's part of what helps in having the slides and, having in some cases I think they all have maybe a little extra information in them just so that you can go back and read and the things that you heard, maybe you can start kind of cementing in your brain because you're able to go back and read them again. So we'll make sure that you've got those.
All right. So again, if you have any questions, and I understand there's a lot of information being provided to you, but that's what we're there for afterwards. And once you get time to think through your questions, and I'm sure we'll be getting emails, and hopefully we can schedule some individual calls. I just wanted to point out one thing that that a supervisor also is going to want to be familiar with, and also the employment specialist, is, of course, we need to know what's billable and what's not billable, right? So there's a scheduled rate, once you assess somebody, not a vocational assessment, but assess somebody for eligibility, and you sent that information to AmeriGroup, and maybe that takes 30 minutes. You're going to sit with that person and gather some information. You send it to AmeriGroup, and then they approve it, and they send it back to you, and you're approved for those 30 units for that 6-month authorization. Once you receive that, you can back bill for the assessment, the 30-minute assessment that you did to determine somebody's eligibility. But if that person is not eligible, found eligible, then you would not be able to bill for that initial assessment of eligibility. So this is something to think about. So you don't want to send that form into AmeriGroup, start providing services to an individual, and think you're going to be able to bill for the services that you provided. Only thing you'd be able to bill for before you receive that 6-month authorization is that period of time that it took you to assess that person for eligibility.
Hey, Lisa,
Other thing,
Darren,
yes.
One thing's learned as part of that, it was always very that people made was up on that. I was able to use provider one for that. So that facilitated a process error group just to be eligible.
We're losing you, Darren. You're, at least from my standpoint, the audio's phasing it out. So what I will say, and tell me if I'm wrong, is what you're saying is a person's got to be active in provider one in order to be able to bill for services. I know the agencies I work for, their provider one status would lapse, and we would try and bill and find out we couldn't, and so pay attention to whether they're active in provider one. Did I get that right?
Yes, thank you.
Okay.
Perfect. So then we've talked about IPS. We've covered a lot of material. I just want to emphasize there's Medicaid benefits. So these are services for a individual. So every case note, every form is for this one individual, and that's what you'd be billing for. So individualized services. So the time that you spend with them, assessing, filling out the vocational or career profile, the time you're out there in the community trying to gather information about what they're interested in and what their likes are is a billable service. Now, generally, pre-COVID, it was face-to-face services. These are not phone calls, but there has been more flexibility about billable services by means of virtually or telehealth and phone calls. I would suspect once we get back to, I'm going to be optimistic to say what is normal, Don, not the new normal, is that these, again, will be something that would be a face-to-face service. But right now, there is more flexibility, and I would have talked to Mayor Group about what that flexibility looks like. So vocational job-related discovery and assessment, billable, all the time you spend with that individual doing that. Career advancement services, helping people attend school and providing academic support. So some people are going to come to you and their goals are not going to relate to an entry-level job, or they are not going to have the education or skills to be able to obtain their job. We never want to limit people based on our own perceptions. And that's something I really want you to hear, especially when we're talking about individuals that individuals are going to be coming to you, and maybe they've been homeless for a period of time, maybe they haven't worked for a period of time, but it doesn't mean they haven't had jobs in the past. It doesn't mean they didn't have a life before this. So they might come to you with years of experience, and it's going to be really traumatic because maybe they've lost a lot, but not to limit what they're able to do. Some people will come and entry level is where they're going to start. And maybe some people are going to start at entry level while they're looking for a better job. So looking at that career advancement services and helping people obtain that. So the time that you might spend doing research with them, not for them, okay? In this case, spending time with them on the computer, spending time with them at a work source office, spending time with them at a college campus, but doing this with them, that is a billable service. Individualized job development and placement. So we know that job development with somebody is a billable service, right? But also job development without that person present is a billable service. That's always been a billable service. That was something we felt very proud for, because usually a Medicaid service, that person has to be face-to-face, and that's to make it a billable service. But it was always that you could job develop on somebody's behalf and be a billable service. One thing I'd like to point out is there's been, by depending on fee-for-service contracts, you always have to depend on person, them showing up for appointments. And you have to have so many billable hours to be able to pay for wages. And so how do you schedule that? Well, at least there is some flexibility with job development on a person's behalf. It doesn't depend on if somebody showed up for an appointment. That depends on your job developer that's out there doing job development on somebody's behalf. By putting I want to say that just one other way, is if you're job developing and you're job developing in general, you're just job developing at any place, with nobody in mind, that's not billable because they're individual services. So you have to connect your job development to Joe, to Jill, for it to be a billable service. Ongoing follow-along support. So of course the follow-along support that you're providing that person after they get a job is all billable. But also that follow-along support that you're providing by connecting with that employer is also a billable service. So to emphasize that in the next bullet down is that conversations you might have with an employer about what kind of supports a person might need or what kind of accommodations they might need is a billable service. talking with that employer on that individual's behalf, and or assisting an individual to advocate for themselves. And one of the things we talked about was the job coaching. So if you actually are going to do job coaching on site, providing that emotional support, that is a billable service. And then the time that you might spend with an individual helping them identify their benefits and how their benefits might be affected by working is also a billable service.
Really good points, Lisa. And I just want to reiterate one more time, that whole job development on behalf of a person, the team and I used to use it when somebody would be a no-show or a cancellation, and as Lisa mentioned, you have to have a certain number of billable hours to pay salaries. We'd turn right back around and go out and do some job development with people in mind so that we could, so we refilled that that time we lost with something else that was billable. It's huge. I mean, it's a coup that when they were negotiating with CMS that was approved. It always has been that way, but I think it took convincing to get to that point.
And just, these are individualized services, so everything that we've talked about shouldn't be boilerplate language on your forms. Entry-level position. So if you as a supervisor are reviewing chart and you're noticing that an employment specialist is getting people jobs at the, in the same type of work, or getting people jobs at a lot of people at one employer, or it doesn't mean they're trying to do anything wrong. It just means that it's a training issue. It's their limited understanding of what the job market is, or it's their limited, are there insecurity about approaching different types of employers, or how to approach different types of employers. But it's a training issue. So being aware that looking at their individualized services that they're providing for potential opportunities for training. Also, what I said beforehand, what is that it's a 30-hour, 6-month authorization, but you don't want to limit people's services to 30 hours. Some people might only need 15 hours in that 6-month period of time, right? And then some people are going to need more than 30 hours in that 6-month authorization point. When you're, down to 10 hours left, and that person is going to need more than that 30 hours for that 60 months, because maybe in the rare case that you're doing job coaching on site, it's eating them hours up very quickly. There is a form that you fill out with a mirror group and ask for an exception. They're going to ask you how many hours that you think you'll need, and there'll be a conversation, and then you can get authorized for more hours. So this individual is requiring on-site support. Or another example would be maybe they got a job, they lost the job. So all that, so you're kind of starting over again scenario. So you're going to require more than that 30 hours, that 6-month authorization. I think when Lisa says 30 hours, I know you can see there 1 unit's 15 minutes. So 30 hours is 1 hour is 4 units. So 4 15 minutes. Yeah. So yeah, but you're absolutely right. It's 30 hours, but kind of broken down more than that. Yeah, it's interesting. Housing is a per day, 30 days of service, whereas supported employment is 30 hours, but broken down into those 15-minute segments. Interesting stuff. I would clarify with the mirror group where their guidelines right now are on for phone calls. I'm suspecting that they're still authorizing the phone calls for things that they weren't authorizing before. But I would just, if I was you as an agency, I just would want to get clarification so you know that what you're doing is billable. I want to give you another non-billable service. Somebody an employment specialist sitting at their computer doing research on a person's behalf, but the person isn't with them. So the person would need to be virtually or you're masked up, do you see what So I want you to be really clear about what is a billable service. It's not sitting at your computer on a person's behalf. It could be with them virtually.
Good distinction. Well, it looks like we've got about 11:54, so about 6 more minutes. Does anybody have questions? I don't see any new ones as yet.
Hey, Don, this is Darren. I just want to, let people know that AmeriGroup does.
Oh, Darren, we lost your audio.
Sorry.
Could you? You're back.
Okay.
I'll try again.
Just in terms of the FCS, does provide question and answer meetings. I think they're about monthly, and a lot of providers get clarity from some of the questions that even we brought up today. So they're constant themes during those meetings and gives you an opportunity to get some clarification from the SCS contractors.
Very good point. And I think the meeting is actually tomorrow.
I think it's soon.
I think it's tomorrow. Let me double check here. Well, if I could get out of the Escape is not working. I say tomorrow because I'm actually supposed to present a little bit of something. Oh, there we go. Now I'm out of it.
It looks like the community says it is.
It looks like we have a question. What if you're contacting employers on behalf of a client remotely? Darren, Don, I've been out of the loop on that. Emails are not a billable service. Remotely, if that's what you mean by that. So if you're calling someone, it is now a billable service just through COVID, correct, Don, Darren?
Yeah, it would have to be something kind of reflecting back to the medical necessity piece, of Medicaid. It'd have to be individualized. Definitely you can have remote contact with employers, talking about your program, talking about the strengths of the individual and advocating for specific things.
Okay, so
initially it was not going to be, because, well, they're supposed to be face-to-face, building the relationships with employers. But as of COVID, as of today, it's still a billable service to call an employer on behalf, but not email.
Right, temporarily, but I think email is included, texting's not. That I would have to follow up on, I'm not positive. And just to clarify, temporarily, this is not going to be a forever thing. Once we're able to, employer contacts are going to need to be face-to-face again.
So yeah, let's follow up with to get some clarity on that, because again, I've been out on a new adventures, and I'm sure I'm missing conversations to get some clarity about emailing for sure, just how they flux, that we can get that information out to them as part of the email stream.
Absolutely.
Because I'd be interested to know the answer on how much they, I just knew they flexed with the phone part.
And part of that too, they had to, the HCA had to get permission from Medicaid in order to be approved to do like Zoom contacts, virtual contacts that way, phone contacts, telehealth contacts. That determination had to originally come from Medicaid, and I know that's something that DVHR had periodic meetings too, to talk about COVID-19 updates and in relationship to documentation, a variety of things. And, that was certainly part of the topic. Which is where I think I saw that emails might count, but don't do them on my word only. Find out for sure. All right. Any other questions. I see a yes, it is, Dawn. Is that, Diana, is that relationship to email?
I think it was FCS
yes,
is happening tomorrow.
Is that the meeting? Okay, yes, it's tomorrow. Got it. Good deal. And I see, looks like Deborah and Diana both participate. All right.
All right, so
I think,
is there a way we can get them added, the people that are not added to the AmeriGroup list added?
I would encourage folks to do that individually. The FCS TPA, and I'm going to have to look up the rest of the email addresses where you would ask to be put on the distribution list. And the truth, if they become an FCS provider, they're automatically on that list.
Okay.
Yeah. All right. I don't see any other questions. And I think we're at our time. Thank you, everybody. I appreciate your attention and being here.
Yes, thank you, everybody.
Yeah, thank you for your time today.
FCSTPA@amerigroup.com is the email address that Diana added. Thank you. All right. Bye, everybody.
All right, take care. Thank you again.